Good morning. I would like to kindly invite colleagues in the room to take a seat. We are about to start. Welcome to the second day of the workshop, to the participants in the room and also to those online. I think we have had very fruitful discussions yesterday, and I hope that those in ECHA enjoyed the cocktail in the end, and you had the opportunity to have also side discussions, which are also very important in such meetings. The session, the third session of the workshop, the one we'll kick on now, is related to the longer term perspective. How fast we could make progress, how do we see the direction looking beyond the current regulatory setting for REACH and industrial chemicals in general. We have a number of speakers in this morning, and then we start with the perspective from the Commission, from the DG GROW, which will be introduced by Georg Streck. Georg has been working in the Commission
It's anyway normally then translated as non-animal methodologies. I have by now also given up really to explain that to the policy level, even then when one then starts to say well, the word new means there are methods included which are 10 years old, 20 years old, 25 years old. Latest then, it's not possible to really explain it anymore. I would also say briefly what I mean with animal testing. Here I use the term in the context of the Directive on the Protection of Animals for Scientific Purposes. That means animals are alive, non-human vertebrates, which any vertebrate which independently, including independently feeding larvae forms, the fertile forms of mammals in the last third of their normal development, as well as cephalopods. Okay, and then I can move on. I want to start briefly to say something about the REACH information requirements, because that is where the animal testing under REACH is coming from. Well, you have heard about that already yesterday. We have certain information requirements in the Annex 7 to 10. Some are, let's say, on more simple endpoints, others are more complex endpoints. We have the same information or similar information also required under other pieces of chemical legislations, the biocidal product circulation, the plant protection product circulation, just to name two. So I think it is also important to think a little bit beyond of REACH when we want to move out, when we want to move towards animal-free regulations. It's not only REACH. Immediately and indirectly, we also talk about other legislations. So how to move forward toward animal-free regulations? We have had yesterday already quite some fantastic presentations telling us what we can do, how we can move forward in the development of NUMS. But I think it is also clear that we are not yet there at this moment to replace especially some of the more complex endpoints in legislations. So I think we need to have more thinking about the process, how we come towards animal-free regulations. And yeah, I think we also need to rather look on a stepwise approach for each information requirements or for each endpoint to analyze what we have, to see is it possible to have a one-to-one replacement, or for the more complex endpoints, can we do it with a combination of different methods, or if that is not possible, maybe to rethink what do we really want to protect, what do we need to know for that, and then how we reach that goal in the end. And that is, of course, not only for REACH. We also need to look on how does it fit with classification. There are slight differences, I would say, how the legislations are built up. So it's not so easy to say, well, we replace one of the information requirements and automatically with that we also make the necessary progress for the hazard classification. We need to look on that together. Well, one-to-one replacements, we have some examples for that, but they are not many. And I think also now with the revision of REACH, we will probably anyway reach here the end of what is possible to do with one-to-one replacements. So likely we need to look on more combined ways, combination of methods, how to replace the information requirements. I had listed here examples, skin sensitization, skin and eye irritation, where we have made already the replacement. Whether this is a one-to-one replacement or whether it's already a combined way of replacing something, well, we can also discuss about that. So how to move forward? I think for each information requirements, we need to analyze the options which we have. We need to see what we can do already now. We then need to define the steps needed. We need to see what are the methods under development and when maybe they will become ready. What's about financing, etc., etc. We need to think about validation, one of the topics we had yesterday. We also need to then analyze what are the impacts if we made changes in legislation. And finally, at some point, we then really can come to make the necessary changes in legislation. And as said, I believe also in the spirit of one substance, one assessment, we need to look beyond REACH and CLP. And it's, I believe, also very clear that this is nothing the Commission can do on its own. It's quite important that the agencies are involved, the member states are involved, but also all stakeholders. So this needs to be quite a collaborative approach which we need to take here. I also want to come back to a topic we also had already yesterday, other possibilities to reduce phasing out animal testing with the focus on looking on exposure, emissions, uses. We have such approaches under REACH in Annex 11, Section 3, where there is a possibility to omit specific information requirements, the OECD 421 or 422, the short-term repeated dose test, toxicity test, under very specific conditions. So there are examples of that, but I also have to say that this option is not applied very often, probably because the conditions are really very specific here. We also have in REACH the principle that for lower tonnages, which are manufactured or imported, we have lower information requirements, lower amounts of information requirements. One can also think that for lower tonnages, there might be lower emissions and exposure. For environmental hazards, yeah, this relationship can normally be assumed, I think, but for human health hazards, it's a little bit more difficult. There, the link between the tonnage level and emission and exposure might depend greatly on the uses. But I think that one could think here about a system, how to incorporate emissions, exposure, link it to the tonnage levels with other information on uses, physical, chemical properties, to think then really, is it necessary for those substances, especially low tonnage substances, to have animal testing for all the substances, or can we not say for some of these substances that here we are already controlling the risks. Okay, I also have to say that such a system, we had discussions on that already in the Commission, also with ECHA. It is clear that at the moment, exposure-driven emission, exposure and use-based waiving and triggering is difficult to implement due to the technical setup of the databases, but also there are challenges for checking compliance, and there's likely then also an issue with enforcement, which we certainly would need to further analyze. What is required? How could one do that? But I think it's worth to explore that further and to see how such approaches could be applied in the future. Grouping as a possibility to reduce animal testing. I think we have later a presentation on omics. I think that omics is quite also a good tool to help us to come to better groups and to do grouping. Grouping has, of course, a potential to reduce animal testing. We need to clarify how such biological information, for example, from omics, can support grouping based on structural similarity. For that, I think there's also still quite some work to do. There are issues when we talk about grouping, about which group member to test, then who is registering such a substance, which is a group member. Then it raises cost-sharing issues. It raises issues about data sharing rules. For biological information, to submit that to the agency, I think it is necessary to have the right templates. While the OECD, we have heard that also yesterday, has developed the omics reporting framework. So one step forward. we need guidance on the use of such biological information. Also here, I think there are still quite some steps we need to take. Then I was also asked to address issues like mutual acceptance of data as well as legal certainty. I'll come to that in a minute. Patience was already yesterday pointing to the OECD system of mutual acceptance of data. That the OECD test guidelines, the validated OECD test guidelines, are the basis for the multilateral agreement of accepting data in different jurisdictions on the global level. I think that is indeed quite an important point which you would like to keep. It is also crucial for reducing, phasing out animal testing globally. It does not really help if we here in the EU switch to non-animal testing, but in other countries, the EU companies are still asked to submit animal test data. And of course, it is important for the companies exporting. It is important for the international trade. So from that perspective, I also think that validation of test methods is in principle quite important. Well, what is in fact really important is that we still have the mutual acceptance of data. If we can agree on an international level how to be sure that the test methods which we apply are of good quality, maybe going away a little bit from the current validation process, then of course this is maybe a way to go. But I think we want to keep this mutual acceptance of data. So we need to agree on the international level how to keep that. Then for classification, we have the UN Global Harmonized Systems of Classification and Labeling of Chemicals. I think also there that is something we need to think about how to bring into the UN GHS. The possibility to classify via NAMs or non-animal methods. So that is another step which we carefully need to think about. Legal certainty. It is important for industry to have clarity to know how to fulfill their obligations and the conditions of what they submit for acceptance by authorities. Similar for the authorities, for the agencies, it's quite important that the data fulfill the requirements, the data which are submitted by industry fulfill the requirements. So we need to have clear provisions in the legislations that facilitate the checking of compliance and will that also facilitate in the end enforcement. This legal certainty for industry and authorities helps the predictability. In the end, it also then that avoids animal testing if industry has not to generate data again if they are not accepted. It avoids definitely delays in providing information for the assessment of chemicals. So legal certainty is quite important. So the description of the information requirements or the classification criteria need to be as clear as necessary. So how to move forward? You heard also yesterday that the European Citizens Initiative Safe Cruelty-Free Cosmetics Commit to Europe Without Animal Testing submitted their initiative to the Commission on the 25th of January. The Commission has to reply to that by the 25th of July. And we will do that with the communication that outlines the legal and political conclusions on this initiative, as well as actions the Commission intends to take. So this document will then certainly outline steps forward. I cannot at the moment, also due to that, that we are still working on that, say a lot more about what we will do. the process of getting the communication through the Commission ties a little bit my hands at the moment to say more about that. But I think that is then the document, this communication is then the document with which we will outline the next steps. But as said, I believe it is quite important now to define a process, the different steps for replacing animal testing. It's not yet maybe then the time to completely know how to do that in practice. This will need time, but we need to start working on the process, how we can do that. And as said, this needs the involvement of all stakeholders, member states, agencies, but also industry, NGOs. It needs also the involvement of the scientific community. Maybe I should also already tell you here that, of course, in this context, we then think how to do that, how to involve the stakeholders. Maybe this could be done with a follow-up workshop to this workshop here. We will then more concretely discuss the different steps. I think with that, I'm at the end of my presentation, and I see I even managed to save a little bit of time. Okay, could have shown more of my slides.
Thank you very much, Georg, for the presentation and reiterating some of the issues mentioned also yesterday in relation to the aspects that we need to consider when moving towards an animal-free system, like the legal certainty, the mutual acceptance of data, information on exposure, and so on. We will move on now to the perspective from the research on how to accelerate transition to animal-free regulatory setting. And I would like to invite Merel Ritskes-Hoitinga from the Utrecht University. Merel is a professor in evidence-based transition to animal-free innovations at Utrecht University, and she's very committed with the work on the 3Rs and with the goal to replace animal testing since she graduated university. She founded Circle, which is a systematic review center for laboratory animal experimentation, already in 2012. And her current focus in research and teaching is on inter- and transdisciplinary research to achieve the goal of accelerating the transition to animal-free innovations. Merel, welcome. The floor is yours. You can keep an eye on the time. Yeah. Let's put the presentation mode back.
Thank you very much for the nice introduction, and thank you for inviting me here to speak on this topic of utmost importance, accelerating the transition to an animal-free regulatory system. This is a necessity for the improvement of our society, our environment, and the countless lives of animals and humans. Together, let us make this transformation a reality. The overview of my talk is as follows. How did I get here where I am today? Where is the evidence behind our actions and legislation? Can we act more upon scientific evidence using systematic reviews more? What about accelerating the transition to animal-free innovations and transition science? And I will end with the importance of setting goals and taking leadership. Allow me to share a glimpse of my personal journey. It all started with a literature review on atherosclerosis in the rat at vet school at Utrecht University, which made me decide to work towards better quality science, better animal welfare, and better translation. When I graduated, I still believed that animal studies could translate well to humans, and I did a PhD on refinement. I then became the head of the animal unit, first in industry and then of 2 academic labs in Denmark and the Netherlands. At the academic labs, I was the manager of the animal units, combining it with a professorship with the aim to implement the 3 Rs in the daily management. I first founded the 3R Research Center and discovered that striving for the 3 Rs in itself is not an efficient method. I therefore moved on to developing and using the method of systematic reviews and founded Circle. The results of systematic reviews have made me realize we need to move on to replacement. So I'm back at Utrecht University now and member of TPI in the Netherlands, the transition to animal-free innovations, with my full focus on this transition. Researchers at the animal units I worked always told me we need to do animal studies because the legislation demands this. I then teamed up with historians to study how these drug regulations came about. We have come to realize that our reliance on animal studies in drug legislation lacks a solid foundation of scientific evidence. Health disasters in the past led to demanding animal studies through new regulations, but they were not firmly grounded in clear evidence from scientific research. You can read that in the Swartz paper on the left. However, then the COVID-19 pandemic pressure showcased our ability to adopt flexible approaches. Vaccines were developed and approved for the market within a year, which would normally have taken 15 years. This rapid progress was achieved with fewer animal studies, a greater acceptance of alternatives, use of historical data, and a quicker initiation of clinical trials. It became evident that we could act more decisively and effectively by relying on scientific evidence while embracing the alternative methods. I would like to emphasize the use of systematic reviews, a methodology that brings forth the most objective and comprehensive scientific evidence, and thus leads to better evidence-based decision-making. For the clinic, this is the routine for clinical trials since the beginning of the 1990s, when the Cochrane collaboration was founded, delivering evidence-based medicine. However, strangely enough, preclinical systematic reviews are not yet the routine. Systematic reviews provide transparency on the low publication quality and limited translation of animal studies to human applications. These findings indicate an urgent scientific need for change. However, it is essential to acknowledge that change often faces resistance. Change requires perseverance and active management of transitions. This is where the concept of transition science comes into play. Then what is transition science? Transition science employs the multi-level perspective transition analysis, offering us a comprehensive framework for driving change at various levels. Geels et al. Explains what this is all about. The figure on this slide shows that many processes influence one another and interact with one another, which often is a non-linear process. At the bottom left in the figure, we see the word niche innovations, which refers to the development of new methodologies like organoids and AI. In the middle, we see socio-technical regime, which refers to how we do things in culture, science, and regulations. At the top, we see the socio-technical landscape, which refers to society at large. What does society think about the use of animals? And what about human safety and protection? Well, we've heard a lot about that yesterday. In transition science, we try to identify the barriers, leverages, and opportunities in the niche regime and landscape level, with the goal to identify opportunities to accelerate the transition. In the Netherlands, the transition program to animal-free innovations, TPI, has embraced this approach wholeheartedly. TPI's mission is to enable better prediction without relying on lab animals, catalyzing a national and international transition towards animal-free innovations. The partner program was founded in 2018 and encompasses 11 partners, including a recently established young TPI organization. TPI runs in conjunction with the 3Rs policy to ensure animal welfare as long as animals are considered needed. This slide illustrates the multiple stakeholders involved in TPI. Funding organizations, university organizations, NGOs, ministries, and an organization called Health Holland for public-private partnership research, Young TPI, etc. We have regular multi-stakeholder meetings where we agree on mutual actions. And I've been also part of a masterclass last year to learn transition science altogether and again decide on actions altogether. Collaboration is crucial, particularly at the European and global level, to validate, accept and implement non-animal methods, NAMs. Netherlands can of course not do this alone. TPI is actively engaging with other EU member states to initiate conversations on NAM validation, finding common ground to improve the validation process. By aligning our national efforts and fostering a European and preferably also global approach, we can achieve more and faster progress and increase the likelihood of success. You're welcome to contact our ministry for further discussions. You see the details on the slide. I've personally experimented with the multi-level perspective transition analysis in education, and the results have been promising, and it was a fantastic experience to work together with students and teachers that way. This approach fosters co-creation and interdisciplinary learning, providing a solid foundation for implementing transition science in various fields. This course also resulted in a publication in Animals, which you see on the slide, and in writing a new grant, which has also been awarded, and I will come to that in one of the next slides. Recognizing the importance of research in driving change, the Dutch Research Agenda, NWA, has allocated funding to 3 consortia dedicated to non-animal models, acceptance and implementation, and social sciences have to be part of those consortia. I'm honored to be part of one such consortium, which we called SAFE, Safety Assessment Through Animal-Free Evolution, which focuses on integrating transformations and transitions through transformative governance. Our focus will be on the next generation risk assessment and the legislation for both chemicals and pharma, and we will look at both the EU and US legislation, so it will have a transatlantic focus. There are several ongoing transitions in our world that are also interrelated. Transitions inform and influence one another, and the underlying causes of it all are studied to detect opportunities for acceleration and then do action learning to see what happens if you use those opportunities in further research. It is crucial to acknowledge that providing scientific evidence alone is not sufficient to bring about real change in practice. We must embrace mixed methods research and flexible approaches that combine quantitative and qualitative studies. Inter- and transdisciplinary research is essential in addressing the complexities of this transition. Transdisciplinary research refers to interdisciplinary research, and also reaching out to society. Science is here for society, so also needs to interact with society. Let us reflect on an example that highlights the need for incorporating social sciences and transition science. The monocyte activation test, a reliable alternative to the rabbit pyrogen test, was validated 25 years ago. Yet it has only recently been really incorporated in the European Pharmacopoeia. Why has it taken so long? This question necessitates the involvement of social sciences and transition science to understand and overcome the barriers to implementation. Also, several speakers yesterday addressed this particular issue, that there are many norms available, but they are not implemented yet in the regulations. Thankfully, promising developments are taking place, indicating that the transition is indeed happening. Multi-stakeholder articles, such as the one by Van der Zalm in 2022, describe how to build scientific confidence in non-animal new approach methods. I think we should adopt that Julia Bain's expression, not only talk about new approach methods, but add non-animal, as we heard that the OECD also can point out new animal studies when they're talking about new approach methods. Additionally, we see initiatives like the European Citizens Initiative, the European Parliament's call for a roadmap, the Food and Drug Modernization Act, the European Medicines 3R, the European Medicines Agency 3R Working Party, the European Food Safety Authority Roadmap, and this European Chemicals Agency New Approach Workshop all contribute to our collective progress. I would also like to highlight a significant Dutch initiative, the Virtual Human Platform for Safety Assessment of Chemicals and Pharmaceuticals, also mentioned by Aldert Piersma yesterday. This platform focuses on the next generation animal-free risk assessment by prioritizing human biology and human data and integrating in vitro and in silico data aimed at improving the predictive value. It also exemplifies the power of close collaboration between stakeholders from science and regulatory bodies and many others. So let us work together to make the transition, a reality. We must phase out animal studies and embrace alternatives as soon as possible for the benefit of animals and humans alike. The science and technology needed for this transition are here, as I have been informed by the experts from the Joint Research Centre. To achieve our goals, we need to forge new academic pathways rooted in more evidence-based decision-making. We must foster transdisciplinary research and education that connects stakeholders from various fields. Embracing multi-level perspectives, transition science, and transformative governance will guide us toward success. Setting goals and showing leadership helps and can be useful and effective in this respect, and allow me to go back in history. In the words of President John F. Kennedy, we choose to go to the moon. We choose to go to the moon. We choose to go to the moon in this decade. Not because it's easy, but because it's hard. It will serve to organize and measure the best of our energies and skills, a challenge we are willing to accept, unwilling to postpone, and intend to win. He spoke these words in 1962, and the landing on the moon happened in 1969. Similarly, let us choose to adopt new approach methods. We choose to go for non-animal new approach methods only. We choose to go for non-animal new approach methods only. We choose to go for non-animal new approach methods only in this decade. not because it's easy, but because it's hard and a challenge worth pursuing. We will only use norms because it will serve to organize and measure the best of our energies and skills in a challenge we are willing to accept and unwilling to postpone in the interests of all living creatures and our environment. So together, let us accelerate the transition to an animal-free regulatory system and make it happen. Thank you very much.
Thank you very much, Merel, for these inspiring words. As you say, and as said also by other speakers, it's only by working together that we could eventually succeed to move faster on this path. The next speaker in this morning will give the EPAA perspective. EPAA, probably many of you know what this is, the European Partnership for Alternative Approaches, which brings together stakeholders on aspects related to alternative testing, meaning regulators, the Commission, the agencies, and also industry and other stakeholders. So I would like to invite Gavin Maxwell, who is the industry co-chair of the European Partnership for Alternative Approaches, to bring the EPAA perspective. Gavin has been very active. Oh yeah, haven't seen you. Very active in this field, and since few years also trying to energize the regulators to work closer with industry and find ways to accelerate the transition. Gavin has been also very active in the field of skin sensitization, developing the test guideline and taking a leading role and in a few of the EPAA projects that aim to replace animal testing. Gavin, you are welcome. So without further ado, the floor is yours. I will try to... okay.
Yes. Thank you, Ofelia, and thank you to the organisers for the invitation to present today. It's a privilege to be here. So just to build on Ophelia's introduction, I just wanted to take a moment to explain to you, and particularly for anyone who might not be familiar, what the European Partnership for Alternative Approaches to Animal Testing is. This is a unique collaboration between the European Commission and industry that was founded back in 2005 with the vision to replace, reduce and refine animal use for meeting regulatory requirements through better and more predictive science, for example, new approach methodologies. As you can see, there's a number of companies and also industry associations involved in the EPA spanning 8 sectors, and we're supported by 5 European Commission DGs and also the partner agencies, including, of course, ECHA. We're advised by a group of independent experts that sit on the Merel group, and they provide us with a peer review of our strategy and objectives and contribute to every steering committee meeting. So if you're interested to know more about the EPA and maybe to get involved, then I encourage you to take a look at our annual report from last year. We fund a number of research projects in the area, as well as contributing to dissemination and communication of work that we're involved in. There's going to be QR codes throughout this presentation, so feel free to scan them and get a direct link to that report. But what I'll do today is focus on the EPA's activities and a general perspective on where we are if we think about regulatory testing of chemicals. And I'd be remiss to start that off without giving a global perspective, which I think we had an excellent overview of yesterday. But just to reiterate what we see, we're in the middle of a global paradigm change. I appreciate it feels messy, and as Rusty pointed out, we may not know exactly where we're heading, but I think that's what it feels like. We're in the middle of such a massive change. Munir took us through this excellent paper that's come out of the APCRA collaboration, the Accelerating the Pace of Chemical Risk Assessment, a collaboration co-led by the US EPA, Health Canada and ECHA, where we start to see the enormous potential of NAMs when used alongside exposure information for setting bioactivity exposure ratios for given chemicals. And not only that the NAMs, in this case, the majority of the NAMs, 89%, were able to derive protective ratios, but also this starts to give us a sense of you can use these for screening and prioritization, and I'll show you in a minute, potentially also more. We're also seeing organizations like the US EPA, as Rusty took us through, really move on to planning the change within their own agencies, talking about how do we deploy NAMs across all their activities, and how can they learn from where we are with current approaches to make sure that the NAMs are being used to improve the assessments that they are doing. And if we look to the government authorities in Canada, they've been able to go yet further. So using the science approach documents, they are updating guidance and providing guidance to apply the latest methods. So this was a document that came out in 2021, 1 year after the Katie Paul Friedman et al. Paper, which shows and helps people understand how they could apply the bioactivity exposure ratio concept to their own work. And I think in this way, what you can start to see is this change is ongoing. We're all at different points within this change, but there is the opportunity for people to opt in, whether you're an early adopter or you are just coming to this change at this point, to ask the question, how can you use NAMs to replace or in some cases reduce animal testing for regulatory use? So as Merel nicely illustrated, we're also in the midst of a large-scale change within Europe, and we saw repeated commitments yesterday in line with this transition to animal-free sustainable innovation. The European Parliament, with a resolution in 2021, made it very clear that they wanted to see an accelerated transition towards innovation without animals, including research, regulatory testing and education in that remit. They were looking for an action plan with ambitious objectives, reduction targets and replacement timelines. And in the Commission response that followed and subsequent statements from the European Commission, we've seen continued support for this overall goal, stating that the ultimate goal of full replacement is enshrined in EU legislation. And crucially saying that we already have the instruments in place to accelerate this transition. It's about intensifying those current efforts. So ahead of this talk, I was asked to think about what are the barriers that we see if we think about this transition, and how is EPA supporting an accelerate of this transition, which hopefully nicely builds on Merel's perspective. So from our point of view, what we're seeing is that our contribution is through addressing those three main barriers. We've all had this insight over the past few days and over the past few years of how many NAMs are currently being used in a research or a case study capacity. but haven't yet made their way through into systematic use within regulatory frameworks. I see part of EPA's mission is about bridging that gap, ensuring that we're identifying NAM-based frameworks that can be used to address those priority regulatory needs. We've seen as well, and I think this is going to be a continued challenge and why it's so important we keep coming together like this, that we're all learning at different speeds. Our different sectors have approached NAMs in different ways. We're at different points. We're often using the same approaches, but we've got varying experiences with them. And therefore, it's increasingly important that we create fora for scientific dialogue between industry and regulatory safety assessors to compare our experiences and build where we have consensus. And finally, this need for a multi-stakeholder collaboration to make sure any replacement roadmap for regulatory testing of chemicals is successful is crucial. And I'm not just talking about the Commission plus industry, I'm also talking about academia, NGOs, any stakeholders that will be crucial to ensuring this roadmap is a success need to be part of the setting and implementation of that roadmap. And I believe EPA provides a platform to really have that broader set of discussions. So, obviously EPA has been involved in NAMs before they were called NAMs. What we had though was a workshop back in 2021 to really review what our experiences were in terms of use in NAMs and regulatory decisions for chemical safety. And this highlighted these challenges. We talked a lot during the workshop about the promising work that is being done, very interesting papers where NAMs are being applied, and these being crucially just short of being applied within regulatory settings, and we explored a lot why that was. We talked about differing experiences and how from our perspectives, whether regulator, industry safety assessor, academic, how we were seeing different perspectives on how useful these NAMs were and where their challenges lay. And crucially, we talked about the fact that this had been a very useful discussion, particularly in the middle of a pandemic, and that we needed to come together more readily. Those conclusions are published, and you can see the publication on the screen, and I would encourage you to download that and digest them in more detail. But what you can see is the opportunities and challenges span science, regulatory frameworks, and education and training, again hitting many of the points that Merel spoke to. From that has come an excellent idea, an excellent opportunity, I think, to immediately start to move into action. The NAM Working Group 1 looked at how could we bridge that gap between promising science and regulatory application, and working with the ECETOC team that drafted the framework for chemical safety assessment, incorporating NAMs within REACH, the publication, again, QR code on the screen. They were able to look at the framework that was published within that work and start to have conversations about how could we address this? How could we encourage people who are working on approaches to submit them for regulatory use? And that was, as Elizabeth launched yesterday, turned into the NAM Designathon 2023 challenge. The initial phases focused on human systemic toxicity. As Elizabeth said, we're aiming at trying to address classification. So we're looking at categories spanning toxicodynamic and toxicokinetic properties. And there will be a webinar coming up soon to share more details if you would like to apply. But in the meantime, note the information and get thinking, because we want to make sure as many people as possible submit ideas, and then these will be discussed as part of a workshop next year. Working Group 2, meanwhile, has been talking about how do we deal with this challenge of the need for ongoing cross-sectorial scientific debate and discussion around NAM use to assure we're not learning in silos and ensure we're taking regulatory needs into account. When thinking about this, we've drawn on the inspiration of how EPA over the years has supported the skin sensitization endpoint and allowed discussions around NAM use all the way back from individual NAMs, defined approaches, integrated approaches to testing and assessment. ECHA hosted a series of training workshops, but really discussion forums over the years, and that has evolved into a skin sensitization NAM user forum, which still meets today and is recently submitted a number of IATA to the OECD. We think we can extend this concept and we must take it broader. We see the opportunity to go into those more complex endpoints that were described yesterday and really create discussion for it to build scientific consensus on where we are in each of these areas. And our hope is through doing that, we will identify much faster the approaches that have promise for regulatory use and application. So ECHA have been kind enough to host us, and the kick-off workshop will be in the 7th to 8th of December, and we'll now work with the team to build on this workshop and think about what are the key topics we want to cover and how would we organise that session to make sure that we can get everyone involved who's interested to be there. The other way we have these cross-sectorial discussions are the EPA Partners Forum. These are commonly annual events where we come together to look at topics which are either underrepresented within the EPA project or of emerging priority. We look at what the research gaps are, what the challenges are, where are we needing industry regulator dialogue, and we look at the opportunities for cross-sector collaboration. Last year, we met to discuss exposure considerations for human safety assessment, and it took us 2 days. We couldn't get through it in 1 day, so we had to come back together 6 months later. And what we found was that there was an enormous opportunity to look at how exposure information, exposure tools, and exposure-based frameworks are being used to really standardize the approaches. And whether we're talking about bioavailability information that can contribute to point of departures, or whether we're talking about external exposure information, there are opportunities to do more in this space to facilitate and maximize the use of NAMs in decision making. If we look to our topic this year, hopefully this will make quite a few people happy. EPA has not worked on the environmental safety assessment space in the past, and we felt we needed to correct this and come together and talk about use of NAMs and environmental safety assessment. This Partners Forum will be hosted by CEFIC and organised in partnership with CTAC, ECETOC and ICCS, the International Collaboration on Cosmetic Safety. And this really gives us an opportunity to come together again and look at what is being done and where can EPA engage to really accelerate use of NAMs in regulatory testing. So we've all talked about the need for a replacement roadmap for regulatory animal testing of chemicals. What EPA is also here for is trying to support the coordination and increased collaboration as we work towards that goal. Now, EFSA published the development of a roadmap for action on NAMs and risk assessment last year and held the very successful One conference to debate the conclusions and get input on that report. ECHA has organised this fantastic workshop to have a similar set of discussions around how do we think about an animal-free regulatory system for industrial chemicals. I'm happy to see I'm seeing emerging consensus themes on where we go next. And I think the opportunity is there to very quickly move into action. And like many others have said, we shouldn't wait to agree on everything before we do that. But what we do need to do now is increasingly, I think, work towards what are those next steps in thinking about a roadmap and how do we continue to coordinate these discussions to make sure they retain their multi-stakeholder flavour, both in terms of the scientific discussions and also these other more high-level discussions as well. And part of that and coming together in that way is also about how do we work with the European Parliament. EPA held a lunch debate with the European Parliament in 2022 on accelerating the transition to animal-free sustainable innovation. which resulted in a really interesting dialogue with a number of MEPs. As you can tell from the picture, these are challenging exchanges. The MEPs are very passionate about this area and they want to see rapid progress, but they're also confused by what they hear. They hear differing messages from a lot of the groups they talk to, and therefore we will go again to the Parliament in this September with the goal of trying to show the diversity of views within the EPA partnership and allow them the opportunity to ask questions and really engage with people. And look for the consensus that we hope we see. We're also involved in PARC through the Synergy Network. I think many of you are familiar with the PARC, or the Partnership for Assessment of Risks and Chemicals. This large collaboration of 200 partners covering 28 EU countries is really a great opportunity to move forward in embracing next generation chemical risk assessment for both human health and the environment. And EPA is proud to have joined the Synergy Network, and we're certainly going to be making sure that we work with the PARC group, not progressing activities that are potentially redundant or conflicting with what they are trying to address. So to summarize, EPA is accelerating the transition to animal-free sustainable innovation through addressing the scientific research to regulatory use gap. We believe we can do that through identifying NAM-based frameworks that can address regulatory needs. The NAM Designathon Challenge is the first of what I hope is a series of activities in this space. We're working to build cross-sector scientific consensus by creating fora for scientific dialogue and working with everyone who wants to be part of that discussion to ensure that industry and regulatory safety assessors can meet and share their experiences on NAM use. And whether that's in our user fora or the partners fora, we're moving that forward. And then we're working to make sure that as we develop, scope and implement an EU roadmap for replacement of regulatory animal testing of chemicals, we do that in a multi-stakeholder way through supporting events like this, but also making sure we make a good connection into the Parliament, other initiatives, including PARC. So I'd like to leave you with a vision. What we are seeing is this paradigm shift where we're increasingly seeing NAM-based testing strategies that have the potential to short-term reduce, long-term replace animal testing for chemicals. We know that from this work that has been done to date that there is the opportunity to use NAM data alongside exposure information and computational approaches to increase our confidence in addressing human health and environmental protection goals. And ultimately, we're part of a huge change as we start to consider what the revolution is we need in our chemical innovation process to ensure that we're embracing green chemistry and sustainable chemistries. We can use NAMs to ensure that chemical regulatory testing can evolve to better protect people and our planet and support new chemical innovation. We just need to work together. So with that, I'd like to thank you for your attention and acknowledge all of my EPA partners, collaborators, and of course the Secretariat. Thank you.
Thank you very much, Gavin. I would like to invite all speakers from the first session for a panel discussion here on the podium, and also to remind that we have a Slido poll going on, so you are kindly invited to respond to that poll. Thank you. Again, thank you for the talks this morning. I would like to start the discussion with perhaps a challenging question. What do you see that it's the biggest change that we need to consider to enable transition to an animal-free regulatory system?
For me, particularly being here over the last 2 years, it's become increasingly clear to me it's mindset. I know that's simple to say, but if we all believe that we are heading towards a replacement of animal testing, that means we need to reprioritize every activity we're involved in and say, will that contribute to a replacement of animal testing, not a reduction? And that's a different mindset. And I'm seeing a lot of promising science being shared, but not all of it will contribute to replacement. So the challenge, and I heard it repeated multiple times, is for us to move forward by identifying the things we can agree on now and commit to them and not worry about the overall roadmap. And I think Rusty did such a good job of telling the story of how change feels and how it's felt for the EPA, and the fact that by focusing on the next step and not the entire journey, I think that's how we move forward. But I would like us to move forward with a new mindset.
Sure. Well, I think that one of the challenges is that we have quite a lot of different steps to do. Also, if we see how we deal with non-animal approaches at the moment, what we do, there are a lot of things going on. We see how science is progressing very, very fast. There's a lot of information which we have to digest. And for moving forward with non-animal approaches, also there we have quite a lot of different steps to do. We have to think for the different toxicological endpoints, how to do that. We have to see what still needs to be developed, how do we fund that, what's with validation, how do we bring that into regulation. So there's simply quite a lot of things to do. And I think it's quite challenging to bring that really together and to the point, so that that we are moving forward with a fast pace.
Yeah, I agree completely with what Gavin said. We need the mindset, especially because when I hear from colleagues from Elizabeth that the science and technology are here to make the move, then I think, well, then we must do so. And so we need to get our act together and set goals and make a roadmap together so that we take concrete steps and set milestones and whatever, so that we get it done. So it's easily said and done, more easily said than done, I know that, but we do it in economy all the time, setting goals, right? We have 3% growth this year, we aim for that, and then all of us agree on that. We can do the same thing here. So set goals and roadmaps.
Yes, indeed. Thank you very much. I think the change of the mindset, it's an important element. Probably in this room and also online, we have the people that think in the same direction. So it's not going to take a lot of effort, but let's also consider that we need to convince many more citizens, may be convinced, but it's also about the scientific community overall that needs to consider this change of the mindset. And yeah, when talking about changing the mindset and also about the scientists, how do you see that we could address the scientific uncertainty in the decision making? Because this is also if I can call it, the elephant in the room. When we have a certain basis for for taking science to regulatory decisions in the current context, this would need to be considered differently in an animal-free system. How do you see that we could address the the scientific uncertainty.
I can start. Personally, from my own experience, I've seen the enormous power of computational approaches to help with uncertainty characterization. I think we need to be very honest about the level of uncertainty we're operating under at the moment with traditional animal tests, and how much of the confidence we have in decision making is not coming from that animal test data. It's coming from all the expertise that we put around it and all the experience we bring to the table. By really taking a data-driven approach, you can be dispassionate when looking at that uncertainty, and it allows you to not just, I think, maximize the use of NAMs that are obviously often very complex data sets that we need to use the latest in informatics, statistics, and mathematics to really interpret. But also it allows us, I think, to really clearly compare the level of uncertainty we're operating under now and the one we're moving on to, so that we don't carry more risk into the use case. So I think that's the opportunity, and I see organizations that have invested deeply in their computational capability as they've made this transition are really now far ahead. And I see the challenges for organizations that are still trying to work without those computational tools to make the same leap.
Yeah, well, I had a conversation with Thomas Sobansky before this conference to discuss the presentation, and you told me that we are used to the uncertainties of animal tests and we are not yet used to the uncertainties of NAMs. So that needs to be a process for everybody involved on what is considered a good standardized method and acceptable. And I think if everybody agrees on that, then that's it, I would say. So yeah, it's going for it and analyzing it and getting the scientific data on the table, and then mutually deciding that this is what it is.
Well, I think what is also important, I hope this works. Yeah?
Yeah.
Okay, great. I think what is also important is to have a good understanding of the biology underneath all the tests. This helps then really to decide where are the uncertainties. And another point is that we combine different approaches. Well, we have at the moment the weight of evidence approach already incorporated into REACH, which then helps to address on uncertainties. Thanks.
Thank you, and maybe good also to acknowledge the results of the Slido poll, because it gives a bit of perspective on this discussion. Indeed, there is a path to get there, to address the scientific uncertainty, and also to change the mindset to enable progress. As we can see, more than 40% believe that the transition is possible in 10 to 20 years, while in less than 10 years, about 20%, and the 27% are even more pessimistic about the replacements. But it shows this time frame, 10, 20 years, it shows on the different steps that we need to take, both in science, but also in the regulation, changing the mindset. This takes time. And as said by many today and also yesterday, it's only by working together, by setting goals, that we could achieve faster progress. Maybe it's a time to take some questions from the audience, and maybe we start with the room, and then I will ask also.
Briefly.
Yeah.
Can I maybe briefly also say some words to the Slido survey which we see here? Well, I'm not sure that the question, how long does it take, is really so important. I have to say, well, of course, I'm always then thinking, oh yeah, it takes long, 10 years, 20 years. I could say any year, number of years. But I think my honest answer is I don't know. I simply don't know. For some of the steps, we simply don't know how long it will take. We see there is still a need for developing some of the methods or developing them further. So for that reason, I think it is more important to think about the process now, how we come to replacing animal testing, than really thinking about, okay, we need to phase out animal testing in 10 years or to have a specific year in mind.
But can I then challenge you a bit? Would you be willing to set a goal so that we say we strive for the 10 years or below the 10 years, so the whole process sets in motion, and then we see how far we get? We do that with economy all the time.
I think the goal is to replace animal testing as fast as we can. That is my answer to that. I don't think it helps to set a certain year. We have also seen that in the US. So we're first saying, well, we do that by 2035. They have retracted that, and I think there are good reasons for that. So let's do it as fast as you can. Let's focus on the process. I think that is more important than really to have a specific year in mind.
Yeah. Gavin?
And could I just offer a bit of a perspective? Because I think to fully replace animal testing is a very ambitious goal. Because if you look at any change, there is a very small proportion that will not want to change. They will actually die rather than change. we all know them. They don't have a smartphone and they will never get a smartphone. So we have to think about this population to achieve the 100% as many subpopulations. And I'd like to think we could get to 50 a lot quicker. We could even get to 80 probably in a reasonable time frame. The 100% is quite hard. So again, like Georg is saying, I think it's quite hard to envisage 100%, but I do think we need to think about what are our goals to like really engage that majority that are going to make the difference, and how can we help them feel comfortable with NAMs and have access to NAMs and the expertise to work with them.
Yeah, thank you to the panelists. Indeed, the goal does not necessarily to be certain year, but maybe the milestones. How do we get there? What would help us in 10, 20 years to achieve a very high level of replacement? So let's take some questions from the audience, and maybe I start on the right side because I think they were waiting.
Okay, thank you. My name is Christine Schirmer from the Swiss Federal Institute of Aquatic Science and Technology. And I have a question maybe to all three of you, but I think specifically to Georg and Merel. And my question is, how can we avoid poorly founded assumptions and conclusions taking a life of their own? And so Wim de Koon yesterday asked me, like how long would it take you to replace a fish reproductive toxicity test? Now, I don't know, but what I can tell from my experience is there's a lot of pushback due to, poorly founded assumptions and conclusions. And then we take a lot of time trying to fix these, poorly justified explanations. So I give you two examples, okay? One is when we validated the OECD 249, so the gill cell line assay to predict fish acute toxicity. Out of this whole universe of different chemicals, many of them, by the way, were in the category of difficult to test, there was one which the cell line did not predict very well. And so we explored this and we hypothesized that there is a specific metabolic pathway which the cells do not seem to express sufficiently to do which we don't exactly know what's happening in the fish, but we assume what is happening in the fish. Now, what is the life it has taken on is now that people say this cell line has no metabolic capacity, which is completely wrong. And we never said this. And so I'm sitting in committees, I'm repeating this, I'm showing the data to say this is not the case, but I don't seem to be heard. That's my first example. The second example is what I see like over the past 2 days repeatedly is about this hybrid assay. And so for those that don't understand what this is, I introduced yesterday the bioconcentration assessment in fish and the developed in vitro assay using hepatocyte-derived cells or enzymes. And now the HYBID is actually an assay which is relatively new, and it's using an aquatic shrimp. And so suddenly this assay is receiving a weight which I cannot scientifically at all understand. So why? First, the database is very poor. Like with the already established OECD, we always hear there are not enough data. There are more than 200 data points, chemicals that have been tested. With the HYBID, I don't know, 20, 30? The second point there, Georg, you said it yourself, we need to understand the biology. I don't think you need to be a biologist to understand that the physiology of an aquatic shrimp and the fish are quite different. And finally, we are actually trying to replace here one animal test by another animal test. And so my question to you, Georg, is what is the rationale to give suddenly such a high weight to the HYBID? And maybe to Merel, how can we avoid, these things taking on a life of their own?
Thank you for the question. Maybe if I could remind for the sake of time that if you could be brief in asking your questions, so we give the opportunity to everyone to ask their questions. Yeah, please.
I can't answer your question. I have often been in the situation that I was not heard when dealing with the 3 R's and systematic reviews. And I think my colleague Ingrid Visseren would call this a research question, to do transition science studies on this, to find out who are the stakeholders and what do you need to do to be heard. And then a lot of things we do is not based on scientific evidence, unfortunately. If we look at the drug regulations, Vanda Pharmaceuticals filed a court case against the FDA because they had to do dog studies not based on scientific evidence. And these have been existing for very long periods of time, so we all believe that they are good test methods, but they are not. And from transition science, I've learned the longer these systems have been with us, the more difficult it is to change them. So we all have this belief, because it has been here forever, that it must be true. And so also there, we need scientific evidence discussions and other scientific approaches to break down those barriers. It's not easy. I've experienced it a lot. So.
Well, not being heard, that sounds like working in the European Commission to me. I also cannot really answer your question, but if we think about replacing an information requirement as we currently do in the context of biocoordination, where the HYBID is one of the possibilities, and it was also discussed in the context of the update of the PBT guidance. There are a lot of discussions behind that, a lot of information which is brought together. Well, of course, a lot of input from scientists from ECHA, but also from industry, from stakeholders, from the research community. So it is certainly the case that all that such issues, not all such issues are then discussed, but at least there are the structures, I believe, that those points could come up and could be properly discussed. It's maybe not a satisfying answer to your question. Yes, but I think that is the only way that we need to discuss such difficulties, challenges of such tests openly. But I think normally we have the procedures and the procedures for that in place.
Thank you.
Thank you. Maybe we move to the other side.
Okay. My name is Heike Lauer. I work for Givaudan, based in Switzerland. And actually, I know already that you cannot answer, but I want to raise also a comment regarding the HYBID assay, because we as Givaudan, we have implemented the S9 trout assay like 14 years ago. And we used that for the safety assessment of our ingredients, and we think it's a very good assay. It has a good predictivity. And I just wanted to comment also on your slide that the one where you had the scheme with one-to-one replacement, and then if that is not working, a replacement by a combination of non-animal methods. I think it's not that easy, because the Hibbett is a one-to-one replacement, the higher Lella. But as Christine already mentioned, it is a full in vivo test, so it's not a vertebrate, but it needs all the setup similar to the 305. So I think one has also to take into consideration a one-to-one replacement or another similar approach, which is much easier, faster, quicker. So I think that's something which has to be taken into consideration as well. And I wanted to raise that as an important issue. And yeah.
Yes, well, I fully agree to that. One has to take such issues also into account. But of course, we do that in the context of replacing such information requirements.
Okay, thanks. Yeah, I think it needs some more discussion, maybe the higher Lella versus the 319AB, to have some more scientific background for that. Thanks.
Thank you. I will allow Sylvie first.
Thank you. Yeah, one question about it's linked to what Gavin was saying. It's very much change management. And there's a theory of change management, you're right, which says 15% are a lost cause, they don't have a mobile phone. Forget. 15% will always embrace change, the Elon Musk of the world. Okay. 70% are asking, what does it mean to me? Right? And linked to that, and there are different fears and worries, and rightly so, because there are uncertainties. So I think we should think of organizing some pilots with no regulatory consequences. So people have to come without fears. And those who feel they're not heard, those who feel it has to be with the member states, because we're hearing reluctance as well. I think it has to be with the RAC, because ultimately this will be a regulatory method. So, but we should think and free up the space, the resources and the money. And yes, everyone has resource problems, but let's be clear, take a few cases, try to apply a more progressive approach, see where it fails, see where it works. We all accept, but we move concretely, because otherwise we keep saying, yeah, maybe the applicability domain, but try it without too many consequences, but to gain the confidence. Do you see scope for that in the current setup? And if that's the case, then can it be integrated in the roadmap planning?
Yeah, maybe this is for Gavin more.
Yeah, I see enormous scope for that. I think that would be hugely positive and a step forward. I think my own experiences being part of the cosmetics industry, those kind of scientific workshops where we had the support of SCCS acting as independent experts in there were amazing. They provided us with the peer review and the critique we needed, whereas we were free to be scientists and discuss as scientists, because we're talking about a creative act, and those ideas don't work so well if they're having to conform the whole time to every regulatory rule. And I think where it could help as well, and we've talked many times yesterday about the regulatory system we're developing may not have the same endpoints or classes or constraints of the current system. And I think it might open us up to start to think about what could that new system look like and what would be the positives, but also maybe the challenges of implementing such a system.
I just ask a question because I attended an online workshop by the European Medicines Agency where they invited academics to come to the EMA on the qualification of novel methodologies to work together. Does that happen with the chemicals? Because then what I understand, if you work together from the start as scientists and regulators, then you also going to accept it at the end because you've been part of the process. So does that happen now?
Well, I guess that this is something to consider. There are different settings for such initiatives, and we have, for example, PARC, which could be considered as a platform for moving forward, bringing scientists together with the regulators. But thanks, Gavin. I think EPAA is also good platform for such pilots, as mentioned by Sylvie. Thomas, and then one question from the online from Ulan and Doris, maybe.
Yeah. Okay, thank you.
If you can be brief.
Yes, I will try. Very quick comment and very quick question. Comment, guys. We said yesterday, let's have honest and open discussions. We are not yet there. I think yesterday afternoon session was very clear. We did a lot of progress. Science is progressing. We know more and more, but we are not yet ready for full replacement. That was quite clear from the all endpoint specific presentation. And even in Rusty Thomas' presentation, look, despite all the efforts, all the resources and all the enthusiasm of Rusty, the first regulatory product with which he's proposing is rodent 5-day transcriptomics assay. Why? Because this is something which can work now and can help us with the change. We are not yet ready with the blueprint. We are not yet ready with animal through solutions. So we are going there, but let's not build on the misperception that we are already ready. And now my question, sorry. You know, I have this feeling as a non-developer at the regulatory agency which is meant to implement the law, that I feel like Catherine between those two rocks yesterday on her picture, because at this we have under constant pressure to run the system, stakeholder asking us assess more chemicals faster, more efficient with less resources. At the same time, you're asking be more flexible, be innovative, embark the change, and those two things are quite conflicting. So from the change science, how you see how we can combine those two conflicting objectives, how we can embed the change when we are still driving the car with the old engine. Thank you.
Yes, Merel.
Yeah, I actually discussed, because we had our conversation before this conference, and you said we have to follow and have work pressure and get those chemicals approved. And so we don't really have time to do different things. And so I discussed this with Ingrid Visser, and she's a specialist in transition science and transformative governance. And she says, well, that is exactly a barrier. And so in transition science, you need to identify barriers, but then also transition science should make transition possible one way or another. So she said transitions take time, take money, take efforts from people. So that should be made available. And I don't know, Erwin, maybe you can comment on EFSA roadmap, because I think there is a lot going on and making it possible in the transition. Or he was.
I think, George, where are you?
Well, I don't think that we have time now to go into those discussions.
We can discuss over the lunch.
Yeah, we will discuss.
I would also like, from ECHA side, that we avoid these comparisons, because things are different. And I heard it very often now. EFSA has a roadmap, ECHA doesn't have one. It doesn't make sense to go in this comparison. And we presented yesterday, the frameworks are different, the goals are different, and we should also think a different perspective here. Gavin, you wanted to add maybe a few words?
Yeah, I just, Thomas, for me, the concept of the user forum, what Sylvie just proposed, these are all mechanisms through which we can do both in parallel. We can create space for those more open discussions whilst we continue to have to operate under the current system. Just to be clear though, on your first comment, I think we do need to look at some of the proposals and really ask the question, will they get us to replacement? Adding omics endpoints to in vivo testing will not get us to replacement. We're just continuing to build on in vivo testing, and it won't help build the paradigm. So what I think we need to look and see is, okay, if that is the short-term management measure, what's the scientific leap into the unknown? Could we do in parallel in vitro omics testing, for example? So we start to build confidence in the in vitro platforms in parallel. And I think that's the only difference, because to come back to your point, we don't yet know how much of the science we have. We're now looking at this regulatory testing challenge, and we were going to have to learn together about how far we can go. What we've seen, though, is promising case studies that seem to go quite far, but very different experiences across the areas, and that's the opportunity. How can we create the safe space to compare our experiences, run new pilots, learn from them, and come up with version 2?
Thank you. You wanted to add, I think we are running out of time, so.
I
Yeah.
try to be quick.
Okay.
Yeah, Thomas, also to give an answer to your question. Well, and I repeat myself maybe a little bit here, but I think what is important is then really to have the process to look step by step on each information requirement in this process. Honestly, point out what are the challenges, how long does it take, what are the resources needed to get there. And with that information, we can also go to the policymakers, to the parliament, to the commissioners, and more easily point out what is really needed.
Thank you. And maybe in relation to that, we can take the first question from the online. If you could summarize, Ulla or Doris.
Yeah, hello. Just to say, we have again very active participation online as well. We have around 200 followers and a lot of questions coming into Slido. And the one that got voted most is from Maya, and it is about on which NAMs to focus. So do you think that the NAMs for those OECD test guidelines, where no alternatives to animal testing currently exists, such as chronic toxicity studies, should be given higher priority when it comes to the regulatory acceptance process, possibly even by sponsoring those NAMs?
Thank you, Doris. Who would like to give it a try? Yeah, Gavin.
So I'm going to start with a disclaimer. I have got no European Commission budgetary control. But yes, I think this is a very good idea, and I think it's what we're going to have to start to think about. How can we incentivize? And it might be through sponsoring the evaluation process, it might be doing something else, but we've now got some very clear regulatory needs. I've seen them repeated through so many different presentations, and we have some, I would say, promising pieces of science that could now be moved forward. How do we make sure we accelerate the process of getting them to a point where we can start to think about what their regulatory use would look like?
I go with your opinion.
That's dangerous.
Yeah, but maybe short answer to that. Yes, I think it is clear and has also become clear yesterday again that there is a greater need for moving forward on chronic toxicity. I think we are much more advanced for acute toxicity to replace that with NAMs.
Thank you to the panelists. I think we need to wrap up. We will need also to find a way to address some of the topics brought by the colleagues and participants online. I would like now to thank again for your contributions this morning and invite everyone for a coffee break. We need to be back around 11 o'clock for the next session, which will be moderated by Julia Baines, and where we will continue the discussion about the research needs in achieving the animal-free system. Thank you. Thanks a lot. Very good discussion.
We're there. Okay, I'm going to start asking people to take their seats so we can get the next session underway, especially considering we're before lunch. Always have that goal in mind. So as we go into our next session now, we can start to take some more viewpoints on lessons learnt and where we can move forward with different goals, etc. And one of our first speakers giving us the academics viewpoint is Mark Viant, who's a professor of metabolomics at the University of Birmingham and director of the Phenome Centre Birmingham, a centre specialising in toxicometabolomics. Mark, the floor is yours.
Thank you, and good morning, everybody. Great pleasure to be here. Thanks for the invitation. So yes, I'm going to be giving a academic perspective, and I'm going to break down. We only have 10 minutes each in this session, so they're quick fire. I'm going to break down to try to make a couple of key points, and the first is really quite high level. It's quite generalist. And it's talking about the academic's ability to contribute to what I call the NAMS pipeline, and I'll explain that on the next slide. And it's quite a critical reflection. It's a little bit negative, and it's partly to try and do some expectation management around the role that I think academics can play in this sort of activity. And then, because I like to think I'm quite a positive person, in the second part, in the last couple of slides, I'm going to focus on one particular application. We've seen omics written on many slides, actually, this morning and yesterday morning in particular, which is always encouraging to see. So I'm going to focus on one particular application, which is the use of omics in grouping and read across, and tell you about some of the very recent progress just on one slide. And there is a lot of progress being made, which is very encouraging. But again, of course, there's challenges, and we've been asked to highlight these opportunities and challenges. So, okay, this is a simplification, but this is one way of viewing the NAMS pipeline. There's an initial innovation phase, then there's perhaps what we can term an applied science phase, and then certainly to an academic, there is some sort of magic that occurs in Brussels and this transition of the science to policy. And what I want to do is, first of all, highlight to you from an academic perspective, there is a major chasm between the innovation period of the research and applied science, and a very challenging chasm to cross if you are an academic. And I want to evidence that. So well, you just heard, I'm a professor of metabolomics. I've worked at the University of Birmingham for 20 years developing and applying metabolomics in the context of toxicology and ecotoxicology. And I just want to have a few bullet points about how the academic machine, how academia works. Academics typically, and certainly in my case, don't receive any core funding. So of course we write lots of grant applications and we try and win funding for the work that we're trying to do. Our funders fund innovation science. They do not fund applied science. And what's expected of that work? What does my boss expect me to do? Make interesting discoveries that get published in Science and Nature. There is huge pressure in the academic system to publish in as high impact paper as possible. You can't publish applied science very easily in this field in the top journals. And what about the personal motivation? Why does somebody go into academia for those lovely long hours and low pay? It's because you're a curious individual. You like to ask questions. You like to be able to do blue skies research. You like to be able to innovate. And which is great, and that's why people go there. So, and I got this comment that academics would feel so uncomfortable in the building next door, making decisions. The academic loves to ask a question and then ask a deeper question and a deeper question. We just love getting into the juicy details, but never having to say yes or no. So there is this genuine chasm, but some people, a small number of academics, and We don't have very many academics here, I don't think, but those that are here, it's great. Small number do want to genuinely try and make a difference and cross that or get out of that sort of innovation bubble or innovation trap. And my particular solution to that actually involved having to spin out a consultancy to be able to put myself in a different environment in which I could then continue and take the innovations that were coming out of the academic sector and to translate them. And this is actually places in a really interesting and fortunate position, because we talk to reach consortia, to companies, chemical companies, and we hear from them about the challenges that they're experiencing and facing. But we also receive funding from, and we've been very, very privileged to have a framework contract with ECHA around omics for the last 4.5 years. And so we hear ECHA's perspective, and that hearing these two different perspectives and seeing quite often the mismatch is extremely valuable for us to try and help such that we can try and connect the dots and basically work more towards these NAM-based solutions. So one of my messages, the majority by far of academics are locked in that innovation bubble. They actually, many of them want to be there. They love it. So I don't say that negatively, but please, as a expectation management for the role of academics in the NAMS pipeline, please understand that there is not a particularly easy ability for the academic to move into the applied science. So in a sense, that may sort of create some illusion that there is more applied science being conducted than you perhaps think, or I think it's actually been realized a number of times that topics like validation, who's actually doing the validation, who's funding that validation, that clearly sits in the applied science box. Okay, so that's quite critical, basically saying that academics don't have a huge role to play in this, unfortunately. Certainly a role, but not a huge role. And I think this is one of the reasons why you can see there may be this sort of, we talk about there's all these NAMS assays, but they're not really moving forward. Well, if they've been innovated, they may well be trapped in that sort of innovation sector because of the challenge of doing this applied research. But let me now focus on the applied science part, just for the literally 2 more slides. And again, say something about the challenges and the opportunities. Now, specifically focusing on omics, of course, my favorite topic, and its application to support grouping and read across. And I want to tell you about the progress in what I call the process. So if you think of it, if you were trying to teach a PhD student, what are the steps involved in applying omics to grouping? You could break this down into 4 steps. There is some exposure experiment, whether that be in vivo or in vitro. Obviously, samples have to be collected from that exposure system. The third one is the actual generation of the data, the processing of that data. And then the fourth one, which is more specific to grouping and ultimately read across, is statistical and mechanistic analysis of that data. So I've got 4 steps here. And written below is the recent progress. We're really talking about progress in the last 3 years. And in green, it's progress, and red is sort of ongoing activities and future activities. And so let me briefly touch on some of this. If we take the exposure paradigm, and I don't want to get into the discussion of should it be in vivo or in vitro and when, let's just talk about the exposure paradigm. I think there's an awful lot of knowledge and expertise about where you would sample, where you would build omics into test guidelines, particularly within different industries. There's certain industries that have been using omics for some time and have colossal expertise. And I said here it's fragmented. I don't mean that in a negative sense. I mean, there's an ECETOC project at the moment looking at smarter test guidelines and looking at how NAMs and omics can be brought into those tests. So that's a very valuable piece of work. I think Tom actually mentioned yesterday on a slide might have been patients in the morning, looking at actually integrating the omics into OECD test guidelines, going through the WNT. That clearly is something that hasn't yet been initiated, but arguably is on the to-do list. Sample collection. Well, here's another important point. It's not like we're the first community to ever use omics. The biomedical community has been using it for a rather long time. And it's really very well established, and there are CROs across Europe who can provide different types of omics analyses. So sample collection and data generation and processing, those second and third boxes, this is really well established. But of course, our community does need to have its own guidance that we respect, and OECD is at the top of that platform. And we heard yesterday, ECHA has now submitted a proposal to OECD WPHA around standardized sample collection for omics. So another step, assuming this proceeds, another step in the right direction. You already seen on some slides, the new omics OECD reporting framework. So that's guidance on how to report an omics study. So that's progress and very recent. Patients was mentioning yesterday, OECD guidance document 194, guidance on grouping, undergoing a revision due to be completed next year. This is also undergoing a revision in terms of how we can use molecular data for the grouping. The ORF is being extended as well to accommodate the description of how you use omics for grouping. So that's a project that's ongoing at the moment in the WPHA, also due to be completed next year. So there's a lot of ongoing activity. And what I must refer to, because there's a number of us here in the room who are part of this, and this is really, truly exciting. We're just coming to the end of a Cephalic LRI project called Matching, which stands for the Metabolomics Ring Trial for Chemical Grouping. 6 different labs involved, a nice blend actually of academic, industry and government. And each of these labs received a set of samples, and each lab then used their metabolomics methods and their own data analysis pipelines and grouped 8 test substances. And as you can see here on the bottom left, 5 of 6 labs in this fully blinded ring trial obtained identical grouping results based on the metabolomic signatures. So honestly, this was quite a lot better than I was anticipating, and we're unpicking why Lab 6 had issues, and we have a good understanding of why that could be. But on my final slide, and my time is out, that's the process. That's the process of omics-based grouping, and you put the scientists together, and there's a lot of pieces there, a lot of jigsaw puzzle pieces that we've had to assemble, but none of it's rocket science. We'll go back to landing on the moon. This is not that difficult. It requires time. I agree with what Georg said this morning. These processes take time to work through. But one of the great challenges now is if I said to you, well, we're actually quite close to be able to conduct an omics-based grouping and we know how to report it, etc. Yeah, but how does this now integrate with what's going on across in the building next door? Because the building next door is a machine in itself, and it has input data, and it has outputs, and it has legal processes, and it has timelines. And how do we bring in adaptations, different types of adaptations under Annex 11 in a manner and sort of experiment with those, because we're not ready to do it today. We don't know exactly how to do it today, but how do we bring that in a way that fits with the ongoing machinery of the REACH CLP machine? And if I may speak, I mean, obviously I wouldn't name names here, but when we talk to industry, there's a general sense of a lack of transparency around how the omics data would be received by ECHA. Well, of course there's going to be a lack of transparency because it's new. These are new approach methodologies. We have to give ourselves a bit of a break here. None of us are going to know exactly what this is going to look like until we start working through and pushing through with examples and trialing how this can proceed. So this idea of having some successful exemplar case studies, I think, is key, and it was great to hear about some of the EPAA activities this morning that relate to this and the value of successful case studies. And my final message is simply to say to those early adopter companies, those companies that have been engaged with NAMs for many years, and others that are coming on board, and your role in this and helping to push and actually challenge the regulatory system, and I mean that in a constructive way, your role is absolutely massive here. So please keep trying, because it's only through these attempts and ultimately generating successful case studies that I think we're going to see progress. Thank you.
So next up, we've got Dr. Blanca Serrano, who is the ECETOC Secretary General, who's been in place now in position for approximately a year. ECETOC, of course, being one of those platforms that provides the space to bring together experts such as Mark from academia, as well as the industry, and putting those together with regulators. And Blanca's going to talk to us more about implementing NAMs.
Thank you very much, and I'm really happy to be here today with you. As Mark mentioned, I have 10 minutes, but no worries. There's a lot that has already been said, so you're going to hear some repetition, which I think it's actually good because it means we are all going in the right direction. As Mark mentioned as well, I'm going to talk about challenges, but also opportunities in the regulatory context for the implementation of NAMs. And I would like to start with something that has been mentioned several times, and is regulatory acceptance. We are taking a leap. We are moving. We have a paradigm shift, as Gavin mentioned this morning. But regulatory agencies do need to ensure that NAMs can produce reliable and accurate results that are equivalent to traditional animal test methods. That's why regulatory acceptance, it's a challenge that we need to all tackle together. The regulatory acceptance of NAMs, as we have seen, varies across different regions. That's clear, and there's different speeds of implementation. And at the same time, there's a lot going on. So there's a lot of research going on in academia. There's a lot of research going on in industry. There's a lot of research going on also with regulatory authorities. And we are not always talking. We do need to communicate with each other to make sure that what we are developing is fit for purpose as well, and can be used. And it might not be at the end, but we need to start the dialogue really early to make sure that at least we're trying to go in the right direction. That's why what I think it's needed, and we've heard it as well, but we need a multi-stakeholder platform to define the scientific and regulatory needs, the gaps, what we need to move forward, and collaborate in the development phase, obtain feedback, and provide faster access to data and information. We've also heard yesterday, can we explore the use of AI? Can we move to a different way of developing these testing methodologies? We do need a framework as well that we are all together in to move, and I would like to also talk later a little bit more about the ECETOC framework for the to incorporate NAMs into the chemical legislation. You've heard about it this morning as well, so thank you, Gavin. And not only this framework, we are in ECETOC, we are also developing other methodologies. It was mentioned as well, the SMART studies, incorporating omics into in vivo studies, or we're also working on stage assessment for NAMs, or the translation of omics for regulatory purposes. But we are only one association. We are a platform for discussion and scientific discussion, but there is so much going on. So not recently in March, we actually organized a meeting with different associations from Brussels and EPAA as well, to try to put all together and in common what we are doing and understand what each other is working on, because we want to accelerate, and for that we need to add and not duplicate efforts and work together. So I think this multi-stakeholder cooperation is really necessary, and the communication is vital between all of us. A little bit on the ECETOC framework. This was a publication from 2021. You can find it in our webpage as well. It does incorporate in silico, in vitro, and in vivo methods designed to meet the requirements of REACH. It talks both about hazard and exposure that can be assessed via this tiered approach. The output of the tiers goes to classification categories, safe doses, risk assessment, and the progress through the tiers depends on the outcome of the previous tier. There is also more conservative than parallel assessment. But for me, one of the most important things is that it allows new methods to be incorporated so it can be evolved. And it works through continuous selective evolution. One other of the challenges that we need to overcome, I think we've also mentioned or heard about it quite a lot, is validation and standardization. We might need to rethink the way we do validation for NAMs. We all feel that the validation right now takes too long. So I think we also need to sit and discuss on how to do this and standardize as well. We've heard a lot about these challenges. I think we need now to really put on paper is when are we going to sit and start working on this. And I think this workshop is a great opportunity to start the work and move forward. We do need to start the work all together. And at the moment, I have the feeling we are all working in our own silos, and we do need to work together in order to find the suitable solutions. It could also be advantageous to take leverage of what we already have. There's a lot of information available and spread across globally. Can we use it all together? And as I mentioned before, can we use AI as well to take advantage of all this information that is already available? And my final point is the cost and resource constraints, but for everything, for the research part, the validation part, but also once they are readily available. We've heard NAMs are cheaper, they're faster. Well, yes, but not all and not yet. They might be. So we do need to work on that as well. We need to see how we can accelerate it. Accelerate the cost reduction and also the implementation. I think there's an actor that we also need on the table, and is the contract research organizations. Not every company is capable of doing it themselves. We need to understand what these organizations will need for this implementation to move forward and for it to be able to be used for regulatory purpose extensively. As you've heard as well, with the chemical strategy, we're increasing the information requirements for low tonnage substances. We also have the registration of polymers. There's a lot of testing that we need to be looking at. So can we accelerate it? Can we create the capabilities as well? For me, we do need a stage implementation. Start with the readily available methodologies, incorporate transitional periods, and review the progress. As this morning was mentioned, can we use pilots, for example? Can we review the progress while we're implementing and be able to stop and go back if things are not going properly as they should be? And of course, yes, work together for the development of more cost-effective NAMs. And I have a slide on conclusions, but it's basically what you've heard already. So I just would like to strengthen that We have so many opportunities to reduce animal testing and replace it in the final stage as well. We need to overcome quite a number of challenges, so we are not there yet, but we are working towards it, including the validation, the standardization, regulatory acceptance, and cost and the resource constraints. We can all work together to solve these issues. We need to develop international cooperation, engage with regulators, with academia, with industries, NGOs, CROs, and optimize NAM workflows. And the continuous improvement of the predictive power and specificity of NAMs, as well as the enhancement of the efficiency and speed, can be further advance the potential and increase their reliability and relevance for regulatory purposes. And from my side, this is all. But if you want more information, please visit the ECETOC website to see our work and our task forces working on NAMs. And we are also right now working on a mapping of the activities going on by other sectorial associations as well, in order to have a clearer picture and be able to identify which gaps we could be working in and not duplicate the efforts. So thank you very much for your time.
Okay, so next up we have Georg Kass, who's, of course, our lead expert at EFSA, and he's published a substantial over 140 papers in the field of toxicology and chemical risk assessment. Georg is going to talk to us more about the challenges and opportunities for implementing NAMs in the food and feed regulatory context. Please, Georg.
Thank you very much, and good morning, everyone. First of all, I'd like to thank ECHA and the organizing committee for having invited me to present EFSA's work and contribute to this important discussion. What I'm going to say today, in fact, has already been said over the past 2 days. So, in fact, nothing new. And I think that's good news in a way. For 2 reasons. First of all, we're facing the same problems, whether we're working at ECHA level, so we're working with industrial chemicals, or whether we're working in the food sector. The other good news is that the tools, the NAMs, are equally applicable to all these different sectors. We're talking about chemical risk assessment, we're looking at hazard effects, hazard identification, hazard characterization. So that is the good news. What I want to show in the next slide here is a bit sort of an overview about EFSA and also bring it in perspective with regards to what we have heard of the past 2 days, which has been very much focused on REACH and industrial chemicals. So at EFSA level, we have a much wider palette of activities, going really from what we call from farm to fork, starting with plant health, going over animal feeds, plant protection products, biological hazards, chemical hazards, and even to nutrition. What you see in red are all those sectors where we deal with chemicals, where chemical risk assessment is taking place. And the type of chemicals we're dealing with are either regulated products, so where we have a dossier that's been submitted by applicants. But we're also dealing with contaminants, chemical contaminants. And here, typically, we don't have any commercial producer that would provide us with a dossier. The chemicals also can be new or could already be on the market, and they would be undergoing a reevaluation. Of course, the difference is the clear difference in terms of the information that's provided, and this brings me to the next issue. One of the to set the scene here at EFSA's level, we're dealing with a huge number of legislations, especially legislation dealing with regulated products, and these legislations stipulate to some extent the amount of information that needs to be provided to EFSA. When the legislation does not provide this information, it's our role to develop guidance documents, and we're in the same position there that we develop a whole bunch of guidance documents that inform the applicants what sort of information needs to be provided. And typically, the information is and remains in vivo studies, so the traditional approaches. But EFSA is moving fast also on the NAM front, not only geared by the EU policies or the CSS, that's really a basis to this, moving into NAV's new approaches, but we also have the EFSA strategy, the EFSA 2027 strategy, where we have key actions on really embracing NAMs, embracing omics, and developing those approaches to contribute to our risk assessment to be able to move away from animal experimentation. And of course, we want to be inside the NAM landscape, both at the EU level as well as the international level. So we have a lot of interactions with many partners, with ECHA, we have the JRC, APCA has already been mentioned, project at the EU level, such as PARC, the ASPIS consortium, etc. So where are we at EFSA's level with NAMs? Due to a change in I should say a revision of the EU food law, the so-called transparency regulation that's been implemented a few years ago, EFSA has received substantial funds which allow it to launch its own projects. And we made a considerable investment into NAMs. From EFSA's side. I counted as something like 32 projects that are dealing or touching upon NAMs. Of course, we don't have our own laboratories. We're in the same situation as ECHA. So these are all outsourced projects, either as grants or procurements to various consortia. And I think we're very much privileged to be able to work with the best laboratories in Europe to help us in those projects. So the areas that are addressed in those projects are toxicokinetics, toxicodynamics, or trying to understand better the interaction between the chemicals and at the cellular level, system toxicology, bringing in the omics aspects, modeling, read across, data management, and but what I really want to say is the emphasis on case studies. So getting this very important confidence in using NAMs. So that is where we have the emphasis. Of course, this is not on our own, many collaborations. In terms of collaborators, we work very closely with ECHA, with the JRC, member states, also with EPAA. We have a lot of collaborations also outside those projects, PARC, ASPIS, APCRA, for example. And then we're also developing guidance documents that incorporate NAMs. So the idea, these are more recent guidance documents where we look very carefully, where can we bring NAMs into the guidance document. So grouping of chemicals, mixture assessments, pesticide residues, read across are all examples of such guidance. And I will just briefly mention the read across, which is, because it's under development, hopefully we'll be ready by next year, at least go into a public consultation. And very much we're exploring here how to underscore really the chemical similarity with additional information coming from knowledge on kinetics, coming from also knowledge, mechanistic knowledge that could be produced by NAMs. Another project I want to mention is that where we've also been working with a number of partners, also the US in this case, is the IATA for DNT, and this IATA based solely on in vitro testing assays, so testing battery. And I think it's important to mention here at this stage that it's also going now into OECD, it's discussed at the level of OECD, and then really the idea is really to get to that step, making it to a guidance, a proper guidance in the at the level of OECD to have it validated that way. But of course, there are challenges. So what are the challenges? First of all, the big challenge we have, we don't get any NAM data. Very simple. We don't get to see them. Certainly, even if they're in our guidance document, these are the new guidance documents, so there's no chance yet to produce the data and to submit them as such. And also NAM-based data remain optional. And then the issue is of confidence building. Many issues have been raised already in this discussion. The issue of validation, having the right performance standards, the right chemicals, reproducibility, etc. we cannot escape from that. We also need to have a change in concept, a frame of mind. NAM is not a one-to-one replacement to, let's say, a 90-day study. Issues of benchmarking, coverage of potential adversity, fit for purpose, ready to use, identification of low toxicity compounds is quite important, because at our level, most of the substances we're dealing, perhaps with some exception in the areas of plant protection products, but generally all our compounds are very low toxicity. But we need to have the confidence that what we identify with LAMPs is also that has sufficient or certainty, lacks the uncertainty, I should say, to ensure that these are actually truly non-toxic or low toxic compounds. So we must have that confidence. And then how can we progress? This is my last slide. What can we do? I believe that we need to have a global blueprint. I think we cannot escape that. Roadmaps have been mentioned, but I think at the end of the day, we really need to know where we're going and have to see what that landscape looks like. So we need a blueprint. And for this, we need to work together. There's no escaping from that. I think it's nice to work together. I enjoy that, but that's very important. We need to work together at all levels. We need an efficient validation process. What it's going to look like, I don't know. I cannot make any comments on that, but we need to move into a way that is much faster. It's important that we adhere to the MAT principle, so it's used, and it's already been mentioned several times, across or globally. And then also at the European level, one substance, one assessment. With REACH, but also beyond, it's important that whatever is being developed, whatever is being validated, that is fit for purpose to have it applied at a level of one substance, one assessment. And then we cannot do this without any capacity building. So it's important to really also train the next generation of risk assessors. And that's all from my side. Thank you very much for your attention.
And our final speaker for this morning's session is Matthias Herzler, who's the Scientific Director at the BFR in Berlin, and he heads up the coordination and assessment strategies in the Department of Chemical and Product Safety. But he does have a particular interest in focusing on the innovation of chemical risk assessment and the applicability of NAMs in the regulatory context. Please, Matthias.
Yes. Hello, everybody, and thanks for the nice introduction. Thanks for having me here. Welcome to Speed Dating, a national member state regulator. So I'm talking about transitioning to next generation risk assessment, or NGRA, about why we should do it, what we should do, who actually is we, and how we should do it, maybe what are the chances and challenges, and what's Spark got to do with it. And same as the previous speaker from the Commission, these are exclusively my own views. They do not necessarily represent an agency view in Germany, wherever. So some useful definitions that was stolen by a colleague yesterday already. For me, NAMs are simply methods not in routine use for chemical risk assessment when I started my job at the BFR 21 years ago. And next generation risk assessment, for me, to start with, means a chemical risk assessment framework that helps us overcome the problems of what I like to call the past generation risk assessment that we are still enacting here. And it relies on NAMs, obviously, and it should not rely on new traditional in vivo testing. We had this discussion about maybe modern in vivo testing and omics and so on. But still, this could be a next generation risk assessment component for a time being, I think. So why do we need NGRA? I'm not going into detail here. We have heard this a lot of times. Efficiency, flexibility, lack of focus, these are problems that we have. And actually, there was a pun yesterday about Lord of the Rings or the Hobbit. So this is one figure to show them all. It's actually showing, many of you will know it, it's showing ECHA's heroic, and I really mean it, heroic and very necessary effort to look into all of the chemicals in their REACH chemical universe in order to find out whether these chemicals need further risk management measures. So where are we now, 16 years after REACH has entered into force? On the left-hand side, so we have around about 13,000 full registrations, I believe, in the database. And on the left-hand side, you see that we didn't have the chance so far to look into more than 7,000 of them. Those were not even looked at by the authorities yet. And in the middle bar or column, you see those chemicals that are currently being looked at or have been initially looked at ECHA. And the big red circles are the ones where ECHA found that data needs to be generated. And these will be in vivo data mostly. So you find this on the website also. And on the right-hand side, these are the chemicals where a conclusion has been reached due to this process. And the light green circles are the ones where actually further, or it's considered that further risk management measures are needed. And it's actually about 25% of the chemicals. You can find it, this is a low number. I find it a very high number from a regulatory point of view. So 25% of the chemicals are not regulated sufficiently enough, or risk managed, not regulated, managed. The risk is not maybe managed sufficiently. On the other hand, it also shows that 3/4 of the chemicals are apparently sufficiently regulated. So 3/4, 75%. We are going to do, you see the numbers on the screen. For 2,000 chemicals, we do more testing. We need more testing, but there's a fair chance that 3/4 of them in the end will not show any need for further risk management. And I might hope that you agree we need to become smarter here and faster. So what do we want from NGRA? We want high throughput and speed. We also want an early filter for real concerns so that we can focus on the 25% and do not do a lot of testing on the 75%. The other things have been mentioned. I'm in lack of time, so I will just go to the next slide and talk about the scientific challenges. And the room is already full of elephants, I think. Many people have brought elephants into the room yesterday. Some of them are here. For me, the biggest ones are really the reliable identification of low or no toxicity. If we manage that, all the other things will be peanuts, you know. And another thing that worries me from at times is we need to distinguish early biomarkers in vitro that may only be a sign of the body doing its job, basically. That's what you have a body for, to interact with the chemical environment. We need to distinguish those things from other biomarkers that really point or will clearly lead to real adverse effects in vivo. All the other stuff is very important too. We need to be quantitative. I don't think hazard-based risk management is a good idea. And validation, integration, and standardization have been mentioned. The last bit is also very important, actually, standardization for capacity building. My most important point, though, is that even though we do not have everything in place here, we can start the transition now because, hey, after all, it's a transition, right? It's not like we work and work, and one day we flip the switch. It will be a process, and we can start right now. But to do that, and thanks for Gavin for making that point already, we really need a new mindset here. And let's go back to Article 25, which everybody knows told us that testing on vertebrate animals should only be the last resort under REACH. And I think you'll agree that this has never really become part of the REACH DNA, if you wish, you know? And why is that? So everybody has contributed to this, I think, all the groups, the regulators, the policy makers, the researchers maybe even. I would like to focus on my own community because that's the one I know best. And I think I mentioned already structural issues, mandate, I mentioned that, lack of mandate to push this forward, also capacity issues, and the procedures, the legislation is not NGRA ready yet. This is an important point. But there's also the mindset issue. And I know, I mean, regulatory or risk assessors like myself, we are trained to find the hair in the soup. So we are very skeptical by nature. You need to take that into account. But also, we are working on authorities and we have a lot to do already. So some people rather took a passive attitude, waiting for people to come up to them with the ready-made methods and the ready-made NGRA concept. You could ask yourself, is this even really our job in the authorities, or can someone else just do it? And I'm afraid, yes, it is our job, because we have a unique position. I think this was mentioned this morning also. We have a unique role and expertise, and also a unique connection with the policy level on one side, with the research level and the industry as well. So some of us, and many colleagues much more than I did, I was more of an observer, some of us have been working on this for quite a while. And now we really significantly stepped up our engagement with the Partnership for the Assessment of Risks from Chemicals, or PARC. So I'm leading a task on a PARC that's called Knowledge Management and Uptake into Policy. And there are two big activities which I'll briefly present to you here. One is called PARC Route, and there we want to develop roadmaps, very much of the kind that have been asked for yesterday by the Commission, for instance. Roadmaps that really practically address the uptake into the legislation part. And we have started this activity. There is an interim report. It's not yet publicly available. It's under review by the Commission, but it will be available on the PARC website. And in this report, we made the first attempt to formulate the vision for this kind of change. The particular roadmap will be called NGRA Route, and we have formulated a vision. It's only a starting point. It will be discussed and so on, but I show it to you anyway. Our vision was that we will provide a concrete and applicable roadmap proposal. Remember, we are only PARC, we're not the legislator, we can only propose. For implementing NGRA as the default approach to chemical risk assessment in chemicals legislation. Default meaning the first line of risk assessment. So traditional in vivo testing should only be done if NGRA is not practically feasible or the conclusions are not sufficiently reliable, which today would maybe be true for 90% of the cases. But you could start now with this. And it's not a revolutionary approach. Compare Article 25, compare what we did with skin sensitization, where we have done exactly this in Annex 7 of REACH. But we also need a strategic roadmap. That's why it's called the roadmap activity. And I cannot walk you through this in detail. There's lack of time. I'm already over time, sorry. But we need to focus on the processes, how to change the chemical risk assessment workflows in the legislation. That's the big one, you know. And somebody mentioned that we should maybe only have a general note on NAMs in the legislation and leave the rest, the details, to the guidance, because it can be updated much faster. And I imagine the Commission, after doing REACH revision, is not particularly inclined to open REACH up again very soon. So we need also a network. I show it will go beyond PARC, certainly. We will invite all of you in due time. We need to prepare this, but also industry. So we're looking for multi-stakeholder participation, and this will be done. The other component, very briefly, is, goes on or understands that this will be a collective effort. We can do something in the legislation top down, but everybody needs to be involved. It has been said a lot of times. We need consensus within a broad and diverse community. We need to connect people, and we have to prevent the Tower of Babel situation where human health doesn't speak environment, policy doesn't speak science, and so on. So what we will bring to you in November is actually the platform that many of the previous speakers have asked for. It's called PARCopedia, and it will be an online knowledge platform and a community space for chemical risk assessment professionals. Last slide. What will you find in PARCopedia? It will be a knowledge base, more or less like a wiki for capacity building. It will have a special focus on NAMs and NGRA, on PARC results, but it will not be limited to PARC. It will be a community space made of profiles, blog posts, discussion groups, and you can present your profile or gain a profile even. We are kindly inviting you to present yourself there and your work, to exchange, to share and comment, to interact, and help us shape the chemical risk assessment of tomorrow. And I should note this will be open to everyone. It will only be interesting to people knowledgeable about chemical risk assessment, but there will be no restrictions, not for industry, not for people from outside. And with these remarks, I would like to close. And maybe by remarking that it needs to be understood that the change is really something that affects all of us. Nobody will escape this. We cannot think anybody can, anybody can survive this without changing. And I invite you to this platform. And with that, I close my presentation. Thank you.
quite exciting there to hear what Park may be coming through that in the future. So as we move on to our panel discussion then, we'd like to explore a little bit more. We've heard a bit about the different stakeholders that need to be involved. We're going to have on the panel now, starting with academia at the forefront of cutting edge research, going all the way through to the member states who might need to be accepting and trying to find the hair in the soup, if you like, and the more skeptical output. So maybe we can explore now bridging some of those gaps. So I'd like to invite our panelists up to the stage. Can we have some microphones? Yes.
How to do it now? You can use this one.
And just as we get settled with microphones, just remind our online community as well that please do submit your questions online, and we will get to some of those today. And keep up voting as well for any questions that you like to see and would like answers to. So I'm going to be cheeky and start with one of my own questions. And as I mentioned before, just now, it's all about bridging gaps, and we do often hear about research providing solutions that do not necessarily suit the regulatory applications. And so I'd like to ask my panelists today, perhaps starting with Mark, if you think this is an issue and what could be done about it.
Well, it's certainly true. And if we go back to my, I think, second slide of thinking about the sort of the innovation phase, the applied science phase and onwards, what we're talking about here, I assume, is novel assays or potential assays being developed in that innovation kind of bubble. I think from an academic's perspective, as long as they've enjoyed what they've done, ideally trained either a PhD student or a postdoc through the process, there's a very solid publication at the end of it. The academic themselves will probably, you know, they've ticked their success box. From this community's perspective, yeah, potentially there are untapped assays, untapped resources. And then I go back to the picture of the chasm. I tried to get an iceberg in, but it didn't fit. So back to the chasm. And how do we get across that chasm from that innovation activity to the applied science activity is a real challenge. I think the challenge is far bigger. It's not for this community to solve. It's just implicit to the academic system and the way that it works. So yes, I think there are some missed opportunities. Maybe if there's significant research activity in the applied science, and I take the point about you can't think that somebody else is going to pick up, because I think the typical academic would think, but that's not my job to now work in the applied science space. So somebody's going to read my paper. That's the classic one, right? Someone's going to read my paper and discover this assay, this great work that I've done, and they're going to take and run with it. We need champions. We need champions to work through larger sections of the sort of the process, the workflow, in particular, at least cross the interface from your zone of comfort into the next zone, if you can sort of say it like that.
Blanca, your ECETOC obviously provides one of those platforms to bring together the rare breeds like Mark with the regulators. Perhaps you'd like to express a view.
Well, I would also like to say this is not exclusive for NAMS. In all regulatory processes, there is a disconnection that needs to be bridged. And I think that's why it's important to have platforms like ECETOC, but also any other platform that can connect all the relevant stakeholders and the knowledge owners, because it is important to have the view of the regulators, but the academics are bringing a different perspective and industries bringing a different one, and so are NGOs. And it's important to put it all together in order to find solutions. I know no one would be 100% happy with, but that work for all of us. So I think that's why it's important to have these dialogues.
So, Georg, Matthias, obviously, you have these innovative solutions. I mean, How do they make you feel when they come to your plate?
I would like to go back to an earlier point here. I think it's quite important to also realize that certainly at the EU level, the landscape has changed dramatically. I'm talking here about the landscape of funding. There are a lot of what used to be sort of projects that were going into more the applied side, but there was no, let's say, impact assessment or opportunity to have an impact, has now changed into a situation where we have projects that be funded with substantial amount of money by the EU, where in fact regulators work together with the academics to ensure that the product that's being developed actually leads to an impact that we can actually use. I mean, I think it started with EU tox risk, then we have the ASPIS cluster of project, we have PARC, and there's been a huge evolution there. And then I think that gives us a lot of, or also give the academics a lot of opportunities to work together with the regulators. And I think what is also important in terms of, let's say, career prospect that in academia, myself having spent most of my career in academia, it's to have also this continuous stream of money coming in to allow this type of activities to be continued. I think that is also very important, that laboratories can be built up to answer this particular question that as a regulator you need the answers for.
Yes, you asked how do I feel about it. I generally feel good about it in principle, but let's not deny the boundaries under which we work. We work under the boundaries of the legislation, and so if we want to build a bridge, it's probably what I just presented. We need to look at the workflows. We need to make them more flexible. We need to pave the way then for people to provide us with the right methodology. And we've started to do that. And George is right. In very early EU projects didn't care very much about regulatory input. Then EU tox risk and risk content. So we are on the advisory boards, and they were very, very, very open to this. But still, I somehow realized that I participated, and it led to some self-reflection more. That was maybe the best thing that these projects did for me, to realize or to arrive at this point where I see it's really us that need to do it, because we can only be the only ones that define what kind of certainty is enough. What have we traditionally gained from the in vivo? What do we want to gain from the in vitro, and so on and so forth.
Thank you. And before I open up the floor to those in the room, I can see from what Matthias was just saying, that fits quite nicely with a question that we have online. So I was wondering if we could first go to that, please.
Yes, we have the first question, the most voted one. I'll highlight it. It's saying that you gave a fantastic talk, Matthias, and we heard yesterday that the member states' competent authorities were some of the loudest voices resisting NAM's integration into REACH standard information requirements. How can we get them on board?
So first of all, they are on board already. I should stress this. It's not like we will not talk with the Commission with, we have the Caracal, we have other things, and they will be on board with all this. But to bring them really on board, I mean, to really make the people in the authorities accept this change. And make no mistake, people in the authorities are not further than we are here. They have the same questions, they have the same problems. To really get those on board, I think there's no way around this platform thing and this guided change management thing, transition theories and so on, will be very helpful in that, I guess. But I cannot be more specific. I don't know. Does anybody else have an opinion on that? Not coming from a member state.
How do we sweeten the member states?
Yeah, I think it's coming back to part of the discussion from yesterday. We need to build trust, and we are asking everyone to change, and change is scary. And so we do need to show that the transition is possible. And I think from what we've seen these 2 days, for me, it's clear that we all have the same goal. We are just not so clear how to get there, but we are all working towards it. So yeah, it's just a matter to put our heads together and also agree that we are going to take the leap as well with the information that we have, and I mean, uncertainty is always there, but there's also with the existing test that we have right now. So it's just a matter of agreeing that this is what we want to do and we need to move it.
I can see some questions stacking up in the room, so I'd like to start with this side of the room, please.
Thanks, David Bell, ECHA. I just wanted to comment that from the REACH perspective, Annex 11 offers us a tremendous flexibility in being able to accept new and alternative methods now for standard information requirements. And that's something we do. It's part of our practice. It's great as far as we're concerned. But there's a kind of flip side there. We've heard how you can produce NAMs and how they can and how they're good and they're acceptable. They can be acceptable. But one of the things about REACH is what we say is that there are standard information requirements, and that means that you have to have certain bits of information, and people who are trying to provide that information have to know when they have provided information that is good enough, and we have to be able to instruct legally binding decisions which say it is not good enough. So with these NAMs, are you going to be able to provide clear criteria where people know this isn't good enough?
Do you want to?
No, go ahead.
Yeah, thanks, David. Certainly we need that. It certainly will need to be done. It can be done, I think, for the methods that qualify in the end. I don't know. The problem for me is still that you mentioned the flexibility of Annex 11, and it is flexible, but it's only flexible insofar as it tries to replace, and we heard that a lot, exactly the things that we do with the standard information requirements. And if we could progress gradually to a situation where we would define the ultimate goals of the data to be submitted and take it from there, maybe we would have more flexibility. But let me come back to the point I only briefly mentioned in my presentation, that was standardization. So it's very important, people in the authorities are really a diverse bunch. They are veterinary pathologists, chemists like myself. I don't know, they don't know everything about everything. So you need to rely on guidance. You need to rely that the best experts provide you with a clear workflow to check a study, for instance, whether it's good. Already now, I'm not a reproductive toxicity specialist yet. I evaluated many of these studies knowing the point where I had to see the real expert, but up to that I could deal it myself because there was OECD, technical test guidelines, but also guidance to show this study is good if it has this and that, and you should look out for this and that to find the hair in the soup, and so on. And this kind of underlying support we will need for the NAMs just as well, totally, because only then people can be, assessors for many endpoints. Otherwise, it's a capacity problem. It's a danger. The flexibility is also, or challenge, let me call it a challenge for the authorities to be as flexible. And also, I mentioned briefly or showed consistency or coherence. Of course, we do not want a situation where similar chemicals are treated differently just because one assessor was very much more flexible than another.
On that question of legal certainty, yes, please, Mark.
Just to add a quick response, David, I completely see where the question comes from. It's an excellent question. And I think this is the challenge from the science end of asking deeper and deeper questions and the real cold face, which is we need to make a yes/no decision. I don't see how we can know from the first study. How can you set thresholds? How can you have confidence to know that if you're looking at molecular similarity, that degree of molecular similarity means that we can put those substances in a group or we can't, and they're in separate categories. So how do we build that confidence? It surely has to come from a number of studies, repeated studies. I go back to the CEFIC funded matching study. There's probably a lot more that we can do now that data has been generated across the different labs. There's still aspects of that study which are blinded. Some individuals in the audience know some details of the study, the chemicals, the modes of action. I'm still blinded to various aspects of it. And as that final part of the unblinding occurs, I think we'll be able to look more critically and try and start deriving thresholds around similar enough or too dissimilar. But we need case studies, and what the environment is to create those, I'm not sure. Is it progressive companies, early adopters, actually submitting the biological NAM data to you under Annex 11, as you described? It is acceptable for them to do that, and it's challenging the system, and the challenge to the system forces a response. Is that one route? Could be, or is it something? Is it like Park? And is it that we need to build more case studies? But that's going to be a much longer road, I guess.
I'd just like to build on that point of legal certainty and what Mark was touching upon there, because we don't necessarily want to end up in ECHA Board of Appeal cases. It's a lot of work for a lot of people. So perhaps how early on in that process do we need to be approaching the regulators when putting together the dossiers and submitting information? George, Matthias, perhaps you have a comment on that.
Yep. Yes, I can start. Yes, it depends on how the different organizations or agencies work. There's specific steps in place that allow, let's say, a dialogue between the applicants and EFSA, for example. But it's also limited in terms of how much advice we can give. We cannot give a pre-submission advice, for example, on data. So that cannot be done. So it depends very much on the organization, how it works. Perhaps important to say that this has also evolved quite a bit at EFSA's level. Now with the transparency legislation, regulation, now we have much more of a possibility of having a dialogue with applicants.
Yeah, I would say that there is a lot of openness in the authorities to discuss new things, but this has to be outside or happen outside of the legal processes, because there's virtually no time to accommodate this. You see this with ECHA and also with ourselves. We have a plan, we have a capacity, and we need to work on dossiers. And if then somebody comes in for discussion and then we make a meeting next month and so on, this is not working in the process really. But outside of the process, I think there's a great openness.
Anyone else in the panel like to address that?
Yeah, maybe very briefly. I think that cannot be the rule. I know at the beginning that's something that will happen more, but everybody to comply needs clear guidance as well of what to do. And it cannot always be a one-on-one discussion. So that's why we would need to establish a framework where there is a clear direction, I don't know, decision trees or which methodology to use for what is more adequate, that is clear for everyone involved. I think that would help, but yeah, it's always welcome to have dialogues.
Yeah, I'm now going to look back to the room where people have been waiting patiently to ask their questions. Tamara, please.
Yeah, Tamara Zitek from ECAE. I want to just shortly come back to the hair in the soup, what Matthias said, and I would like to ask risk assessors and also ECHA and the Commission to not only look for hairs in the NAM soup, but also for hairs in the animal testing soup, because I mean, it is not that animal testing does not have hairs in the soup, and it needs to be compared, and I think it's just different problems we are looking at, but not less or more problems. And I would like to ask Mark if you could comment on the or explain a bit more on the ring trial that you said, the omics ring trial. So what kind of samples are these? Is it in vitro samples, in vivo, and what kind of intervention?
Okay, I'll try and be brief. Promise, Chair. So the study, the animal, it was animal, it was rat. It was a 28-day study. It was conducted at BASF, and it was the same protocols and procedures that BASF have used to build the MetaMap tox
database. Hennika Kamp is sitting just a little bit to your left. So if people have questions later about MetaMap talks, or Hennika's the man for those questions. So 28-day, it was plasma samples and 8 test substances, low and high dose plus controls, and it generated a total of 180 samples, and those samples were literally aliquoted, making equal aliquots that were then, the information was blinded and sent off to these 6 different laboratories. So as a recipient laboratory, so the Phenome Centre that was mentioned in my introduction to the talk was one of the blinded ring trial labs. We received these samples. They're simply labeled with a test substance 1, 2, 3, etc. And so then, and I guess this is an important part. Each lab selected their preferred sample preparation method. Each lab then used their own LCMS-based metabolomics method. Each lab then processed the data using their own preferred methods with 1 or 2 criteria saying you must do this, you must deal with blank data in a particular way. And each lab then applied their own statistical methods to group those samples. Now, even with all of that diversity, and we introduced that diversity because we wanted it to be a real world, transferable to the real world. With all of that diversity, 5 of the 6 labs achieved this identical grouping. And the 6th lab, I'm very enthusiastic about this. The 6th lab was way off, like, so far off you couldn't believe it. And there was massive analytical issues. And we think it's related to temperature in the laboratory, and we're tracking down that as a lead at the moment. So, I mean, we're not talking subtly different. We're talking, there was 5 identical and then 1 that just really didn't achieve a grouping at all. Okay.
Actually, I would like to take the chance of having an omics expert here, because this was all referring to in vivo omics, and we heard a lot of talks mentioning, I think Thomas and also Rusty, that they, as a kind of bridging technology, they are favoring short-term in vivo omics or short-term in vivo tests with omics. Could you give us a very brief summary of the state of the science of in vitro omics? And cell systems. And so I know it's done. I remember the last ECHA workshop, there was a colleague from BASF, and he says, well, in vivo we can do it all, but in vitro there are technical issues, problems a lot. For risk assessment.
Yeah, the actual extraction of samples, the generation of the omics data, the processing of the data, it doesn't matter whether it's an in vitro sample or an in vivo sample. And quite often you hear people will, well, as you really said, yes, the omics seems to be working well in the in vivo scenario, but when we go into the in vitro scenario, we have more challenges. I genuinely believe this, but you might think I have an intrinsic bias here. The issue isn't lying with the omics methodology itself. It's the challenge of the in vitro model. Now, there are increasingly sophisticated in vitro models, and if we think about things like 3D spheroids, there become challenges around physical biomass and sensitivity issues for metabolomics assays in particular. So there are certainly some technical hurdles, but the biological test system itself is less critical. And I mean, again, JRC, of course, is here, and we've been doing some teamed up with the University of Birmingham, JRC, and some work on HEPA-RG, obviously in vitro metabolomics. So I know BASF is doing a lot of HepG2 metabolomics, and some of the different European consortia that George was mentioning. So I think I don't see any particularly large roadblocks around the in vitro omics.
In terms of predictivity.
Yeah, I think it comes back to the stability or not of the biological system. Not the assay.
Thank you. I'm going to head back to the room then for another question, please.
Thank you so much. Regine Schreiner for Revalue Germany. I'd like to address a comment and a question to Mr. Kass from EFSA. So first of all, I'm delighted to already see have EFSA here. Chemicals are obviously not only regulated as industrial chemicals or as cosmetics, but also in different regulatory contexts. I'm delighted to see EFSA also embarks on NAMs. But if the ultimate goal is to reduce animal testing, then I think the first step, which is data sharing, is not so well addressed by EFSA so far. I really come from the feed additive and novel food side. In our guidances, we just really have the normal in vitro and in vivo studies. Of course, this may change in near future. We also have in our regulation the obligation of applicants to share data, but it's not enforced like as it is for REACH. But I think due to transparency now that you see which company exactly does which trials, and there are so many of them, I think that data sharing will become more en vogue with the EFSA applications also. Would you agree to this? And is there guidance for feed additive, novel food applicants, food contact materials applicants for data sharing?
Yeah, thank you very much for the question. I think it's a very important one, and something we've also been discussing internally, externally. Yes, we need data. Data sharing is very important. We don't have a particular guidance, but it's all in the legislative framework. But of course, there's also the issue that certainly initially there's the proprietary information that we as an organization cannot share or make open access. But I think we're all moving in the right direction there. I think that is very important, and that certainly that the information should be shared, because it will help us also building up those databases that are needed to understand the performance of NAMs in the different sectors. So we need the data. Thank you.
Thank you.
Perhaps we can head back to another question online, please.
Yes, there has been a lot of questions, and I can see a lot of questions asking how can we do this, how can we work together, how can we move forward. So I think there's questions how to take the next steps concretely, and there was also questions about platforms and how to actively motivate people to participate in platforms, how to do trainings. And the first question on the top is also about the next step. How can we expect that the EC REACH revision will be able to absorb all these ongoing activities? PARC, ASPIS cluster, EPAA, ICCS, and go hand in hand with the legal certainty. So how do you envisage next steps, and how do you see that?
So obviously this question would be addressed best to the European Commission because they are in charge of absorbing it if they want. We of course have high hopes that they will be absorbed, since all of these initiatives are either funded by or have the participation of the Commission. My small wish would be what I just mentioned in my talk, is really we would like to avoid a situation where certain things could not be done now with the REACH revision, and then there is, no way to change REACH for the next 5 years. So at least if they could allow for the flexibility to do something later, to add something later on where we are not as far, that would be really great. Apart from that, maybe I add something on PARC. PARC has had some criticism, all this money, like 400 million, and all be doing all the same things again and so on. But these are really 200 partners, 7 years, so each partner on average has 300,000 euros. But for me, it's not so important. Each and every in vitro method, they are all important somehow. But for me personally, is each and every project on one single in vitro endpoint or so is the important thing. But the important thing is that we have all the member states there. We have other European countries there. We have a good network. The SYNET was mentioned to include other initiatives, other clusters. Many people working in PARC are actually also working in one or more of these activities. There's a close connection to EPAA. So for me, PARC is really a one-in-a-generation chance to get together finally. And let me be frank, if we fail in PARC to do this, then I don't see how we do it otherwise. Then we will do it the old way, just stipulate from the top, and then we have to live with it.
if I may add to it, and moving a bit away from the reach, certainly at the level of the food and feed legislation, there's some updates that are ongoing. So time-wise, things might fit. But perhaps the more important point to make here, we've seen in the past a lot of activities, research activities have been funded that aim at producing tools for the regulators. I think it's important that the very last step is always implemented, and that's the one that always gets lost. It's this validation process. It doesn't help us if a nice tool, nice method, nice assay is being developed, is being published, but at the end of the day, we cannot use it as regulators. So it's also a plea to people involved in the different project, and this message also I try to pass through all the time, is really the last step is a very important one. It's also a costly one. Miriam described it a bit yesterday, and I also want to re-emphasize this message.
Yeah, I cannot answer for the Commission for sure, but I just wanted to mention that there is a lot of coordination, a lot of people that are in all of these different initiatives. PARC is a very big one from the regulator's point of view. ECETOC is also involved in the International Advisory Board of PARC as well. And as I said, we are also mapping activities going on by associations in Europe, sectorial associations. I think it's important to get all the information of what's going on to facilitate the movement forward, because yes, it's not only those initiatives, there's a lot going on. Everybody wants to move it forward, but we need to have the complete picture, and that's not easy, but it's necessary, and I think we're working towards it already. So
I'd like to go back to another question in the room, please.
Thank you very much. Gil Hendricks, Toxis. One of the stakeholders that has been quite absent from the discussion in the last 2 days are SMEs. Even today, there's a lot of emphasis on academia bringing the, let's say, development of new assays. But in my experience, a lot of the actual validation and getting NAMs ready to actually be considered, at least for regulatory applications, will be the SMEs, the people that take up indeed the technology from that paper and go through that slow and long process of years and years of together, often with larger industry, to develop an assay into something that is really usable. And I think that is a challenging period where funding is always a little bit difficult. It's also, I think you need the interaction with different stakeholders. And I think, to me at least, it seems that stakeholder has been not really incorporated in the discussion so far. And so I was interested, first of all, Mark, on your view, but maybe also to Matthias, and whether this is maybe a little bit better covered in the PARC process. And how can we make sure that the development and validation and getting the assays really ready for real life applications, how that is covered and how we can help them through that valley of death, basically, and get them really ready to be implemented?
So I'll keep my answer brief. I think you've articulated a very clear challenge. The SME, if you want to take forward an assay and go through those procedures, the SME is a far better vehicle for doing it than academia. Academia is an entity in itself. So completely agree with what you're saying. I mean, there are different funding schemes in Europe and certainly in the UK that are trying to support SMEs just for reasons of trying to rebuild economies. So I think there are some options out there, but whether or not somehow within this sector more resource needs to be made available. And yes, the comments about the timescale and the amount of resource needed for validation is eye-watering. And yeah, you've articulated a challenge for sure.
The point is, probably it has a lot of ramifications that lie quite far outside of my own expertise. I understand you're talking about SMEs developing methods, right? not SMEs registering under REACH or something. No. Innovation is probably very often done in very small companies, the real innovation, but I cannot tell you that we don't need validation only because you're an SME. And validation, I always say validation is, from an analytical chemist like myself, it's not a big thing, so to speak of it. It's not a concept that's really something that you need to discuss a lot about. It's really, validation is showing that your method does the job that it promises. And we cannot, we can be more flexible, find new ways of validation, qualification, whatsoever, but we cannot get rid of that. So probably there needs to be an economic solution, which is far outside my range of decisions, how to make SMEs or how to put them in the position to finance this validation process. But I have no answer to you from my point of where I'm standing here.
No, nothing additional.
Oh, yeah.
Just surely, yeah, I agree. There is an issue there that we need to address and solve. That was one of the challenges. We do need to rethink how we do validation and also how we fund it, because if a method is good, is worth it, and it's going to solve our issues, we need to move it forward somehow quickly. So yeah, I agree with you, but I think we need to sit down all together and start finding solutions and start the work, let's say, or continue it.
Yeah, I'd like to head back to our online questions, because I think the top question there kind of maybe addresses that it's not necessarily validation that's a stumbling block.
Thank you. So Yuka Sand asks, now that the NAMs are coming, the regulators will need some training to learn how to assess the data. However, no one has the data at the moment, not even EFSA. How do we train the regulators?
I'm happy to throw in a quick comment. Actually, Kristen stood up, and it's something that you said on your slides yesterday. If there's a need, the market will fill that need. And I think in the training space, it's going to be the same thing. There are sufficient experts, and if there's a need for training, it will be created. I don't think that's any form of significant challenge.
I totally agree. Once you have a methodology that is really ready, accepted now, the training will be no problem. We will see to it that our people are trained, and that's it. And I mean, it's not rocket science. If you are used to evaluate in vivo tests with histopathology and all, of course, you need to know some things about cell biology, maybe. But we have these people. Actually, part of the people that we have employed already are cell biologists by training. So.
Perhaps also to add that our initiative are very much focusing on case studies. So case studies to develop those the set of data, NAM data, to be able to gain this confidence.
Okay, now I'd like to head back to the room, please, for another question.
Thanks. Hi, Carol Courage from Croda. Question for you, George, on a comment. I mean, I suppose it's not that surprising that EFSA haven't had NAMs as part of applications for safety, because we're looking at repeat dose, we're looking at systemic toxicity, which is a data gap where NAMs are concerned. But if a company or a body wanted to come to EFSA with part of their evidence NAM-based, I'm assuming some sort of discussion would have to happen, with EFSA. So you guys aren't used to receiving the data, and how do we do that? So we come to you with some ideas of, right, these are the tests we'd like to do, rather than all the in vivo data. How would that work?
How that works, of course, we have our procedures in place, and they will accommodate this discussion. We have what we call a front desk that is the one that receives the application and also is involved in those discussions.
So those particular discussions around NAMs, it would be quite open to having those?
They could be accommodated, of course, yes.
Okay, it's good to know. Thank you.
Okay, and a final question in the room, please.
Thank you. It's just a comment to the prior speaker here about PARC. I'm not sure if everyone realizes this, but PARC explicitly excludes SMEs. Now, I don't know why this is. I think this is actually fatal, but I just want you to know this, and maybe there's still something that can be done about this. Thank you.
I think that's a very important point because we've all heard about bringing on board all stakeholders, and we need to remain open and collaborative in that aspect. So I'd just like to open the floor to the panelists for any last final comments.
So to be honest, PARC is a huge document, and to read all the things that have been said is quite challenging. I don't know all of this. I don't know where this comes from. I suppose, though, I can only say from my own institution, we have a policy that we cannot, by means of capacity, talk to each and every company. So what we do as BFR, we talk to associations if we have contact with industry, also on our legal matters. And maybe officially, you know, industry is not a partner and cannot be a partner in PARC because it's a public partnership, and neither an SME nor a big company can be a partner. So, but we have our ways of, you know, integrating. It was said, industry associations and so on. Maybe that's the background to there. But I guarantee you, for the activities that I presented, if there are experts that come from SMEs and they want to join us in developing the science, they are more than welcome. Only they cannot get money from PARC, but you know, it's not a matter of excluding you. It's just the way this partnership is set up, I think.
Any final comments from our other panelists?
Just one, and I'm looking at the next three questions, and they're all the same theme.
Can't answer all of them.
And when there's 38 votes behind them, I have to touch on this. I mean, it's talking. Can you see all of them? Yes, good. So it's all around the risk and the likelihood of failure and the lack of guarantee of acceptance of these approaches. And this is a real concern for very obvious reasons. So I'm going to I'll put my academic hat on and just say something really naive. Why can't the regulated and the regulator actually talk a little bit more and manage the expectation such that it isn't likely to fail, that there's a better understanding of what may be successful? So I guess it's a naive academic's call for more dialogue between some of the key stakeholders.
I can only agree. No, I can only agree. I think that's the main thing we need to move. Yeah.
Sure, but I think that dialogue already takes place. It can always be more. I showed you a platform where we can do this maybe, but on the other hand, this is part of the roadmap actually to identify the key players for certain changes. You know, there are certain bodies like Caracal or the RAC or so that are really the key players in deciding whether a new method will be accepted. If you come to BFR, we can provide you with our opinion, but that doesn't help you necessarily with RAC or with, so pointing out these very critical scientific committees and so on, and then organizing a dialogue is the best thing. And we all have lack of time, so it's better to have these events maybe than to have a continuous dialogue. If I had to, you know, add to all I do now, constant dialogue with like 5 SMEs, I couldn't just do it. I'm sorry.
Perhaps from my side, first of all, thank you to ECHA for having brought us all together in this workshop. I think we had very stimulating discussions. We're making progress. Perhaps sometimes we tend to be a bit impatient. Okay, we've been working on in vitro system for many years, but there is progress, and maybe the change is not going to be tomorrow. Maybe we have to wait a bit more to build up on the confidence. But it's a journey that we're taking together. I think everyone, not only in Europe, but also when we look at what's happening across the Atlantic, the same journey is ongoing. Building up confidence in these new tools, working together, trying to understand how they work, and then this is done together as a joint journey with all the participants, all the stakeholders. So first of all, thank you to ECHA for having made this meeting possible.
So I should just wrap up for this morning's events then, where we've heard a lot about challenges, opportunities, and later on this afternoon after lunch, it will be the big question of, well, what's next and what actions can we actually take? And so I'd invite those in the room. You have lunch, which is just outside the doors. It'll be a standing lunch. And for those online, please take a break from your screens and we'll see you back at past in about an hour. Thank you.
Yeah, thank you.
Good afternoon, everyone. Can you hear me okay? So, welcome back. This is our final panel discussion where we're going to be focusing on key conclusions and next steps from the workshop. And it's my honour to present to you this esteemed panel, who I think you know because they've all spoken to you at some point, but if you don't know, their names and affiliations are above there. And what I'd like to do is encourage you to look at the Slido at the moment, and the question up there is, what is your main takeaway from the workshop? So I can see already a subset of you have added your takeaway, but please add to that as I turn to our panel and ask them to answer that same question. Where do we want to start? Julia, do you want to go first?
Okay, my main takeaway is we've got a lot of work to do, because for me particularly, this cannot be a one-stop shop. We need to take on board that there are challenges, there are opportunities, but now we need to address them and actually put words into action, because quite honestly, I'm a little bit fed up of lip service, and that I don't want to be back here in 10 years' time addressing the same issues, talking about the same opportunities. So I would like to pose my own question of, who's going to write the roadmap and when are we going to start? Because if you don't start, then I'll draft one for you.
Okay, so an offer from Julia there. Mark, do you want to go next?
Just a quick response. So in April 2016, about 10 minutes walk in maybe that direction, I had the pleasure of being in the first NAMS meeting in ECHA, and we have come a long way in 7 years. We really have. So hopefully it will be a lot less than 10 years before we're back and progressing. So I think, as a self-congratulation to the community, we are progressing, but we can always accelerate.
Thanks, Mark. Diego?
If I may take those positive words from Mark, because indeed there was the ambition that Merel said, let's do it in 1 decade. I think the confidence of everyone in the room and following us remotely is that actually maybe not in 1 decade, but in 2 decades. So it's not that far off. So there is a good level of confidence. And for me, I would take 2 main takeaways from here. Is first of all, there is a willingness for everyone to move forwards. Okay, we have maybe different expectations on how ready we are and how fast we are able to arrive, but everyone is really willing to move towards a system that don't rely on animal testing. And the second one is that progress is happening. Mark presented examples of it yesterday evening. We also saw actually how we are able to being progress and applying new approach methodologies to understand better biological complex systems that eventually will allow us to rely on fully on non-animal test methods. And I think here, just as a final key point for myself, is we talk a lot during yesterday and today about regulatory acceptance. And I think there is an area where we still have some work to do on understanding what that means. And that really depends on the regulatory context, because the needs from regulators, from industry are different. And we need to understand what are those needs. We try to convey from a reach perspective what are those needs. And if those needs are answered, I strongly believe that the methods will be uptake really fast. But we need to address those specific needs.
There you go. Natasha?
Yeah, actually, I wanted also to come back on that point. I think we heard mixed messages yesterday. We heard on the one hand, oh, we're ready and it's just a matter of getting things regulatory accepted. On the other hand, I think we also have to realize that, yes, regulators have to make decisions that are legally binding. And if I were a regulator, I would feel like I have a bit of a sword above my head, because I know that very likely my decision can be challenged in the Board of Appeal, in the Court of Justice. We're seeing that a lot. So I think that also warrants some caution from the regulatory side in really thinking about how we are integrating those methodologies into the regulatory landscape. And that means that maybe if we're going towards a roadmap, we also need to be very transparent on what do we have confidence in today for screening purposes, and what, on the other hand, we feel we're getting confidence in to actually make regulatory decisions. And I don't think these are at odds, but we really need to be transparent about that.
Thank you, Natasha. Anyone else? Any other perspectives? Georg?
Thanks. Yes. I also wanted to say that I was quite amazed yesterday in the afternoon to see the progress which the research community has made in addressing, especially the chronic endpoints. I really find that quite encouraging, and I also agree that there's quite a lot of work to do. We need to organize that in some way. So I believe that this needs to be done stepwise. We will really look on the different information requirements, look on all the different issues step by step. This will also take some time. It does not come overnight, for sure. Yes, and I think that is rather what we need to do, to work on the process, to come then to a plan how to phase out animal testing at some point. I do not mind to meet here in 10 years again, to be honest, not at all. I also don't mind to meet very soon again to discuss the topic and to make progress.
Thank you. Chantal, did you have a point?
Yeah, it's working. So I think reflecting here, I'd like to support the other comments that I see a lot of willingness, a lot of need for collaboration across all stakeholders involved. I think that is coming out really strongly. But we also see that it has helped us in the past to learn together. And to build confidence and insight together. And that's something that we need to continue to do, science-based. And we have also seen, and I see regulatory is featuring here, the regulatory process hasn't been dynamic enough to keep up with the scientific progress. So that is something that, it's a big opportunity moving forward to include that scientific progress, and also to have a place to discuss that science, so we continue to learn together in what works, and also be open in what doesn't work, so we gradually build confidence.
Thank you. Katrin, do you want a final?
It seems you're eager to have me add something to it, and I see a prominent vote here on the Slido map saying we need a roadmap. And I recall, like Mark does, the workshop from 2016 at which I was present as well. And several of you in the room here were as well, if I remember well. And I think it is already a big step that we are at least feeling confident that we could work together on such a roadmap. And we are saying that also from the Commission side, if I understand well, that right now also other services who all have to do with industrial chemicals are supportive of that idea. That is an important first step, even if it sounds like a small step, it is not. Now that we have taken that step, we will get to work, and we definitely need to collaborate with the partners in PARC and maybe with others. So we will make it a priority and see how far we get, and hopefully faster than in 10 years.
Thank you very much. And if we look at the poll, I think, like you say, Katrin, it's we need a roadmap, so it's shouting out at us. But we've also got some other points in there that are maybe about how we move from this point. So need for action, manage expectations, uncertainty, collaboration, paralyzed by uncertainty. And I guess with that point in terms of the definition of NAMs, if someone's having fun with it and saying new animal method. So maybe that's something where we also need to be clearer when we're calling for new approaches, what we're looking for. So in terms of the follow-up question and thinking about onward steps, so I'm now going to ask the panel, what do you see as the biggest challenge and opportunity for achieving full replacement? And what could be the next steps by whom? Any views? Yeah, Natasha, go. Yeah.
Yeah, next steps. I think it's, as we discussed yesterday, it's not a one size fits all. And there's, of course, the scientific progress and the uptake of the new science, but there's all the other questions we need to ask ourselves in terms of how do we regulate right now? What do we need to change in the regulation? So information requirements. And then really being open to making decisions in another way. So that might mean being able to make decisions on identifications, classifications, restrictions based on less evidence, or looking at coming to conclusions in different ways than we're doing right now. Because as I highlighted yesterday in my presentation, I don't think we can really get around that topic by just looking at the methodological aspect of it. We really need to ask ourselves fundamental questions about how we come to conclusions, because the reality that we all discussed is, again, this iceberg where we do not have enough information on lots of chemicals that are already on the market today. And the priority is doing something about these to reduce exposures of people in the environment.
Thank you, Natasha. Mark, do you want to go next?
Shall we just go along the line? Yeah.
Yep.
Not surprisingly, mine's scientifically based, and it was actually mentioned this morning. The reliable identification of no effect or low effect, in particular when we're looking at molecular level data. And I think this will evolve. It's a bit like if you remember the last panel discussion I was talking about. If you're looking at molecular responses and how similar is similar enough if you want to try and form chemical categories, and these are subjective. If you take Tanimoto scores and think about structural similarity, I think it's through community consensus that a value, and I won't say what value I think is taken as meaning structurally similar versus non-structurally similar. There is no equivalent in terms of molecular response signature comparisons and saying what is similar enough for grouping. And the challenge is low dose or no effect. If you see 20 genes respond in a particular test system, whether that's in vivo or in vitro, what does that mean? And how are we going to use that information? So I think some of the scientific challenges are still there to be addressed.
Thank you, Mark. Brilliant.
I have one very short-term step that I think might be a nice idea. And I know ECHA colleagues have been tracking very closely a lot of the questions that have been coming up on Slido. And I think it'd be quite nice actually for everyone online and everyone in the room to see all of those questions just listed and published, because it gives a very nice overview of where people see challenges, opportunities, what hurdles they think need to be overcome. Because I think those questions, this is supposed to be a discussion forum, and it's the beginning basis of where do we start with a roadmap? What are some of those very key challenges that we need to overcome? And I think that might be a very good starting step for the next meeting that we have, hopefully within 6 months or so, whether it's this big, whether it's a smaller convening of stakeholders and then it goes to wider consultation. But let's start somewhere. And I think, we've seen some really lovely questions coming out. They didn't all get answered, but I think that gives us a nice starting point.
And your challenge?
And my challenge is, let's see some action within 6 months. It is a big job. And I'm not saying we should have a roadmap within 6 months, but let's see those very first steps. And we've seen the first one here today, which has been excellent, because I do agree there has been progress. It's been, I was at that 2016 meeting as well, and I am seeing more positivity than I have ever seen before. I'm seeing more of not just we can't do it, it's okay, well, it's difficult, so how do we do it? And we need more of those. So for me, I think the challenge is that change in mindset of don't say can't, don't say won't, say, well, how? How do I do it then?
Thank you. Georg?
Well, I think the challenge is simply now to start working and bring all the different issues together. I think it's one of the difficulties, that there are a lot of different things to do. But let me also say something to the roadmap. As also said in my presentation, the Commission will respond to the European Citizens Initiative by 25th of July. I think that is for the Commission the time when we can clearly say, well, when we have to say how we respond to the European Citizens Initiative, and that then makes it maybe all a little bit clearer how the way forward will be. I think it will be also important for working on the next steps, as I also outlined in my presentation, to involve member states, agencies, stakeholders.
Thank you. Diego?
Maybe now I'll put a bit more my hat as a European Chemical Agency. On my own words, of course, I'm not saying the words, official words of the agency. But agreeing with what was already said, from where we sit and how we see it, I think it's very important, if I think about the big immediate challenges, is to deal with all the diversity of chemicals we need to deal with, and how actually we can develop and agree on which methods will cover that diversity, that actually make it workable, not only for authorities, but also for industry, on how they will be able to implement and provide the information for us to make the decision. So I see this is critical because it's related with scientific, but also with legal certainty. When we talk about legal certainty, is also about the workability of the system we have in place. Another challenge, which is also an opportunity, as we saw, is the international collaboration. It's a challenge because we cannot walk alone. We cannot do it by ourselves. We see it if we, in one jurisdiction, we implement some rules. In other jurisdictions, if they don't have the same rules, well, we don't solve the main goal, which is avoid animal testing. But also an opportunity, as we saw with the collaborations that we are already currently having with in the context, for instance, of APCRA, and learning how in different jurisdictions with different goals and objectives, we are able to implement NAMs in different ways. So it's not that we need to wait ad aeternum to implement them. If I think about the next steps, then I would say there is a component that is on the innovation, continue innovating, continue to develop NAMs, but then also think about what is the problem statement. So is this transition between the innovation, purely innovation, scientific, but then which is the problem I need to tackle? What is the answer that this NAM is giving me in the regulatory context? And this is very important, is to bridge that gap. And then, of course, from a policy-making point of view, which is accepting that those NAMs are enough to ensure the safety of the chemicals.
Thank you to you, Katrin.
I was thinking about the challenges that you asked us to comment on, and I think a challenge not to be underestimated, but probably to be embraced, simply because we don't have any other chance, is to openly dialogue and discuss with each other about the correct order of things. So in a way, it could be a discussion about the right numbering of the actions in a right order of the milestones in a roadmap, because what I at least felt is still the case in the group here who came together in the workshop, is that there are different opinions about what needs to be in place first, or how much certainty should be demanded for a method, or how good or how universal an applicability domain of an assay should be before one could use it. So I think we need to invest in communication and try to somehow set ourselves some rules of what is acceptable, or what risks we are willing to take, because if we try to eliminate all the hair from the soup, we will never move. So we have to find a way to practically advance, and this challenge of the correct order of steps, I think, is one that we need to embrace.
Thank you, Katrin. Chantal?
Yeah, and you have to watch out. You don't throw out the soup with all your hairs, right? So I think a lot has been said, but there is a real challenge, which is an opportunity as well. Everybody is in different places in that transition change curve. And that roadmap has been discussed now quite a lot. And there's a real challenge on owning that roadmap. Someone needs to own it. That is also the biggest opportunity, though. I think we should all own it. There's the example of the transition pathway for the chemical industry. That is also a big transition that is addressing multiple challenges. This is also a multi-challenge transition that should be co-owned by multiple stakeholders in a transition pathway. So this is the opportunity, and I think one of the actions evidently for industry is to actively participate in that, and that is also, I think, an invitation for all the other stakeholders here present today.
Thank you, Chantal. So I'm just going to draw your attention now to the input we've been getting from our audience and the Slido poll. We asked a question and a way for them to reflect on what action they would like to take following the workshop. And it seems the largest answer is hope. So I think that's somehow success. Yes, I don't know how that makes you feel, Diego, Catherine, Julia, but I think we did some good things there. I think also that there's some nice points there coming out around case studies, talking to regulators, advocating for the science. I connect with people. I think we're seeing that general spirit that I think you finished with, Chantal, of the need for collaboration, the need to share as we learn, and that opportunity to work together, hopefully in a coordinated fashion, is what we need to move forward at this point. So I'm now going to take you to our last question, which is a Slido question for our audience as well for you before we turn to general Q&A. So after the workshop, how confident are you that we can move forward with the replacement of animal testing? Now, we're going to ask our audience this, but I think it's also nice for our panel to reflect on this question. And if I could also get them just to, when you're answering, maybe give an impression of if that's changed as a course of these discussions. So did you become more optimistic or more pessimistic about that goal and how we get there? Natasha, are you okay to start us off?
Again, I think my perception has not changed, in fact, with the workshop. Okay. I think there's really exciting developments with NAMs, and as I said, they are being used to a certain extent today. The challenge is indeed how can we, I think, what I'm still not clear about is how do we clarify the goals of what we want to use them for. Yeah. And I think that we still need to do quite a lot of work around this. But I think, the opportunity is there, and I think we all share that. But we also need to be grounded in reality.
Thank you.
Mark? Thank you. Because of the word replacement, I don't think my position has changed. So I see it. It's in the future, but I don't think this workshop certainly hasn't fundamentally changed my view. If anything, slightly stronger belief. But obviously, there's a few points where there's some disagreement in the room. Immediate replacement seems like an insurmountable challenge, but I'm realizing I'm going to hand the microphone over to Julia in a minute, who's going to explain to me why this isn't the case. But and just one clarification. I'm thinking from the scientific. This hasn't been a science-focused workshop, of course. It was never intended to be that. So at the end of yesterday afternoon, we had a glimpse through the short presentations of some really good science activity. So I guess looking at that, I'm positive looking at that part in particular, but overall, somewhat more confident.
Thank you, Julia.
Might surprise you, I'm quite a pragmatic person. And I'd also like to address some misconceptions, particularly surrounding the Citizens' Initiative as well, which has been a driving force in pushing forward to have a roadmap. Because I would like to clarify that Citizens' Initiative isn't asking for an immediate ban at all. It doesn't ask for everything to stop. It doesn't even ask for a ban. The word ban isn't even in there. What it actually asks for is for a commitment to move forward. And I think we've seen that already. I think we've already seen that from all of the panelists here, that there is a commitment to bring stakeholders together to develop a plan and to work to progress. And I think for me, I'm actually quite positively encouraged that there is that drive and there is that focus of that can-do mindset. And I think we see that probably more in the chemical sphere than what we might do perhaps in basic biomedical research. And there's a lot that can be learnt. I think the fact that we have the academics on side, the fact that we've got the different NGO perspectives, the fact that we've got the regulators, the member states all involved, I think that's a really good platform to say, you know, we are all here together, we've all got the same goal in mind, and we are now all thinking about what do we do when we leave this room and how do we drive things forward. So it's nice to hear from the side that they're going to go away at the Commission and think, well, we now need to start thinking process, because that is the next step.
Thank you. Georg?
Thanks a lot to say that you are not going for an immediate ban, but for a commitment. Well, when I was reading the submission of the ECI, indeed, I think I understood that also as that, but I think it's also important to repeat that message whenever you can. Yeah, I think I was confident before the workshop already that we can move forward, and I'm maybe now a little bit more confident also having seen the progress the science is making on that. But I would also plead for realism that it will take certainly quite some time to really replace animal testing. It's nothing which comes overnight. Also working on the roadmap will need some time. There's quite a lot of work ahead of us.
Thank you. Diego?
I'm thinking if I should answer this question, because I mean, we organized the workshop was to increase the confidence and move forward. So if I say I'm not more confident, well, we were not
just do it
successful.
with your personal hat again.
Okay, my personal hat, thinking about myself. No, indeed, I am more confident, and I'll explain why. I think I was confident, but I feel a bit more confident. For 2 or 3 main reasons. One of them is that I think we're able to, with this audience, broad audience from stakeholders, NGOs, regulators, scientists, which is not easy, because we all came from different walks of life, with different angles, and we were still able for a full 1 day and a half, not full 2 days, but 1 day and a half to, I think, having everyone very much engaged on listening to each other. But also, I think we were able to bring a bit of, like Georg said, a reality check of the ambition and where we are today, with concrete examples of where we are and where we are able to implement, but also being able to identify where we see areas that we can progress, not only in purely scientific development or research, but also looking at the steps on what it means from innovation until regulatory acceptance, start identifying potentially critical steps that would require further attention. And we have started talking about some of them. We talked about validation. We talked about funding, but not just funding to support the regulatory acceptance. What are the roles of different key stakeholders? So my hope, there is a lot of digest. I think I'm not the only one that is still trying to digest all the information, is that actually as an outcome of this workshop, we are able to structure all this information that allows us then later on to start taking more concrete actions to help us to move forward. And I think this for me is very important. And we talked about it yesterday. It's not so much about the roadmap, it's about which actions, which goals, which intermediate goals we want to take that ensures that we are progressing in the right direction. Because others, not only in Europe, made roadmaps with deadlines, and very quickly they realized that that was not the way forward and not was giving the right incentives. But definitely we need to have goals, and I think some of them I think we are able to digest from the discussions today.
Thank you. Katrin?
You not sure there's that much to add, but to go back to the very question whether confidence has increased or not after this workshop, I wanted to say that the work that we put into the thinking which information requirements we could revise and how now already, that has allowed me to, for myself, become more confident than I was before, that there is scientific progress that is sizable and that should be reflected in regulation. And also the talks yesterday afternoon emphasized that impression even more, because obviously there are always some developments that we cannot in real time be aware of. So all that progress is very encouraging. But if I think about the number of people who were involved in the workshop here live as well as online, and if 72% of you are replying that you are more confident, I wondered whether mathematics works here in an additive way or in a somehow exponential way, that this increase in confidence can help us to achieve that shift in confidence and in belief that we need to move forward in that direction at a higher speed than we did so far. So I hope that the math works not only additively, and therefore I'm slightly more confident after the workshop.
Thank you, Katrin. Chantal?
Yeah, the benefit of being last is that you can build on what the others have said, right? So let me pick up, Katrin, on your science comments, because I'd like to be a bit bold here. I actually don't think that replacement of animal testing is the goal. It is the consequence. It is the consequence of using the best available science for chemical safety assessment. And I'm really positive we can move forward on that by actually using case studies. And if you look at all the new science, especially in the research and development phase, let's find a safe place to look at the learnings there, to share the learnings without regulatory consequences, so we know what it can do. And once we move further in the development phase of all those new technologies, we've seen so many fantastic examples of what can be done. So let's also share those case studies in which we have been successful, both from the regulatory side as well as the industry side, in, hey, this is what we actually can do. Let's learn from that and let's pick it up. And also, let's use the best available science to avoid that we create even more information requirements that require animal testing. Can we not start with the best available science rather than with the animal test?
Thank you. I guess just reflecting on the poll from my own point of view, I guess like Katrin, this is a pretty impressive result. I don't know really what our expectations were before the workshop, but I think for me this is showing that when we talk about a change in mindset earlier, that we're really ready for this. We're going to have to keep each other honest and open and keep these discussions going, whatever the motivators are for making that change. But this really shows that we're at a point where the majority, at least attending this workshop, are ready to make that step and move forward with courage. So I'm now going to turn to the Q&A. So our Slido poll has been there. Please go and add a question for our panel and upvote any questions if you like it. I'll also invite people in the room to come to the microphones if you've got a question. I'm going to try and alternate between the microphones and the Slido so that we hopefully get through more of the Slido questions. and Natasha is going to leave in about 10 minutes. So when that happens, that's not because I'm facilitating in a bad way, just to be clear. Okay, so shall we start with our first question, Doris?
Yes, hello. So Pekka Kohonen asks, could you comment on protection versus prediction? Does it change regulatory paradigm in a way as it make it easier to apply NAMs?
Thank you. So who wants to go first?
Shall I just take this one first?
Yeah, go.
I know it's about regulatory, but I'd like to go first one time as well, right? I think it really depends on your NAM. There's different types of NAMs that are designed differently. There's screening NAMs that are really focused on protection, on the catch-it-all, and there is more NAMs designed for prediction. And I see that there is an evolving need to come to a test battery that is suitable for its use. And there is uses for classification, there's uses for risk assessment, for the derivation of human reference values. And the reality is that we need different NAMs that can do different things. And some are better in protecting, others are better in predicting. And for every NAM, there is a place, I would say, also in a future regulatory framework. I'm happy to hand over to a regulator.
So I'm giving the hot mic. Well, I would say that indeed it changed the way we look at NAMs. If we want to use NAMs for protection or want to use NAMs for prediction, it changed. And the fact is that we need NAMs for both. And there are different steps in the regulation where you want to be protective or you want to be predictive. And that is also why it changed the pace in which we are able to integrate NAMs in our regulatory process now, generically speaking. And even if you look at REACH, there are different steps and different needs. So clearly, yes, it would change if you would only take one, but I don't think that is actually possible. So probably making this distinction on when we are implementing, what is the purpose of the implementation of the NAMs, if it's protection or prediction, it will help also to understand a bit better why in some areas of the regulation we are able to have a faster uptake of the NAMs compared with other areas.
Does anyone want to respond? Natasha?
Yeah, maybe I can add on that. I mean, I agree. We need different NAMs for different purposes, but I also think that we need again to come back to the reality of the environment we're operating in, and we're not in a reality in which we have an overwhelming number of amount of information about all the chemicals that are out there. And the situation would be really different if that was the environment we are evolving in. The reality is we have huge data gaps, and that's why protection should actually be still a very important goal. And that brings us back to what I was mentioning earlier, that we need to prioritize which actions we want to go first for. And I think protection still is a very, very important goal that we should keep in mind while we're moving forward.
And I guess maybe in the way this question's posed as well, what's in there as well is whether when we're thinking about prediction, we can move away from the animal test as the benchmark going forward, and whether NAMs give us an opportunity using the protection concept to move away from that, trying to fulfill that animal test information requirement. I don't know if any of the panelists have reflections on that one, or if we want to go to the next question. Julia?
I think you're right. I mean, I think this question on whether it is protection or prediction, I think it just highlights that there is a need for flexibility. And that does open up questions about legal certainty. No one likes flexibility when you have to address a regulatory need or to have legal certainty, whether that's for the companies providing the data, or whether that's for the regulators making the decisions. But I think it does just open up that there is a requirement to future-proof legislative frameworks to ensure that they have that flexibility to grow with the scientific progress. So as we learn more, we can then adapt to the different types of questions that might be posed.
No other responses to that, then I'll go to the floor mic. Matt?
Thank you. Matt then from Unilever.
I don't think so. Do you want to try it again? Oh, something changed. It looks like you've got a mic coming.
Thank you. It's probably my ineptitude. So my question sort of relates to the protection, not prediction. And it also relates to the roadmap, because one of the things that I've observed over the last couple of days is there's still a lot of disagreement, I think, when we talk about different things. And I still don't think we're necessarily talking the same language. So I think the roadmap is going to be absolutely critical in terms of identifying what that destination actually is. Because I think unless we know the destination, it's very difficult for us to work out those steps that we need to be able to get there. And I think the role of protection, not prediction, is really important and fundamental to that roadmap, because I think we saw with the talks yesterday, it's one way where we can make progress in certain areas quite quickly. And in the more predictive way, it's going to take us maybe a little bit longer. So I think these two are complementary, but I think protection, not prediction, does need to feature as one of the destinations for that roadmap. Otherwise, I think we're going to be in the situation where it's going to be another 20 years and another €1 billion. And I just wondered what the panel thought of that.
Thanks, Matt.
You're welcome.
Catherine?
Maybe I can give it a start. As I said, probably every assumption that all of us makes in this space here needs communication and needs checking with others whether the understanding is shared. But my understanding of what the goal of the roadmap would be, or the end place that we want to get to, is a chemicals risk assessment without the use of animals. That is my current understanding, and I guess we have ample time in the future to check whether that is a shared understanding. So that, I think, would answer part of your question, and maybe I can also already jump ahead to the first question here that is prominently in the Slido. Who should work on the roadmap? Who will invite? I think I would hold it with the statement that Matthias had in his presentation earlier. Regulators can't escape from it. So I believe the invitation or the first steps should come from the Commission. I would just like to ask you some patience that we get organized in our own house about how we go about it and how to invite others to contribute to it. But I think we will do the first step. Thanks.
Mark, did you have a...
Thank you. Actually, I'm going to put myself out there and ask a question, if it's okay, and add to that and say, how is the roadmap going to be resourced and funded? Because we can't just carry on adding more and more work to everybody's day jobs. At least I don't think we should, because there's many things that we all need to go away and do, and there's so many challenges identified. So is it realistic that there is additional resource associated with this?
Georg, were you maybe, I think you've been volunteered a little bit there. Would you like to answer?
Well, it was interesting to see before on the Slido poll, there was one phrase popping up on the question, what should we do, and was working harder. I realized that. Yes, indeed. Okay, but well, on the roadmap, I think I'm repeating myself now maybe a little bit, but well, the Commission will come out latest by the 25th of July with the response and outline then a little bit what it will do. But I think it is at the moment maybe too early to think about additional resources, funding on that. We need then also to see that in the process after that. This is one certainly one of the issues we have to think about, but it is simply too early to now have an answer already to everything.
Okay, thank you, Georg. Sylvie?
One comment and one question, if I may. Okay, just to fill the data gaps, we need the NAMs, in fact. And I'll give you an example. We try to we have put together an action plan to voluntarily check the dossiers and assess the gaps. We're working with ECHA. One comment I keep hearing for all the ingredients that one way or another go in cosmetics, and it's many, it's surfactants, it's additives and so on. The companies get stuck because the customers, like Unilever and many others, cannot accept tests on animals because of the cosmetics. So we got stuck, and at the end, they say, we need the ECHA letter, the decision letter, in order to be able to do an animal test to fill the gaps, if it involves, of course, if the gaps involve animal testing, simply because it's the only way it will be accepted to continue to get, you know, the some of the declarations or the animal welfare logos and so on. And it's part of the market, and it's good. But it's the practical limitations we face, and that's one of the reasons where we see, yes, there's an opportunity for the NAMs, but for now we get stuck in practice. What I wanted to say is I actually have short-term high hopes in the new data requirements. I really hope the Commission, I think it's quite progressive as far as I can judge, because I'm not a toxicologist, but what I'm hearing around, what you're proposing is quite progressive. For me, it's a signal that it can change. And I hope that you don't have to backtrack too much based on the comments you're getting. I know it's a process going on. What I'm wondering is whether you could use this annex column 1, column 2, because if you go for, I don't know, QSAR by default in column 1 for acute tox, yes, we may find that there are few chemicals for which it doesn't work, but as long as you have this correction mechanism in column 2, or if you say every 2 years I'm going to reopen or to reassess, or add a new NAM, or I don't know, there has to be a dynamic process with these annexes. And the first step is right now. So I really hope that we get a signal change as part of the Commission's commitment to move forward, and we'll try to move in that direction as well.
Thank you, Sylvie. Did anyone want to respond? So thank you, Natasha.
Yeah, thank you, Sylvia. I think you raised quite a good point. There need to be also some flexibility to take up NAMs in the future, but I think we have in principle that all the information requirements, Annex 11, well, these are annexes, and we can all the time, at every time, open that and add a new NAM if that is necessary. I also agree that there should be a process of constantly reviewing what NAM is maybe mature enough to be taken up, and I think this is an important issue. Thanks.
Okay, thank you. I'm going to turn to Doris again for the next Slido question.
Yeah, just to announce, we have reached already 213 questions, so thanks a lot for being active. Oh. The next question is from Heli, that was top rated. What NAMs are a priority for the panel members? Dread risk endpoints such as reproductive, or rather the general repeated dose protection which drive DNLs, RCRs, so risk characterization ratios, and risk management measures in the REACH dossiers?
Thank you, Doris. Panel, who would like to answer this?
I'm just going to respond to the first question, which NAMs are a priority, but omics being a NAM, I've been working on it for 20 years. I think I'll keep pushing on
stick with that one.
I think so.
Got to keep the funding. It's a really good question, and I would say in terms of from an animal protection stakeholder viewpoint, it doesn't really matter so long as lives are being saved, but it's a case of looking at where can the most difference be made in the short term, and then trying to set those priorities in terms of what are realistic goals. You know, where can we achieve in the shortest time frame, and where's it going to have the most impact? Sometimes that might be for chronic tox. It might actually be in ECOTOX, where I've been seeing some fantastic innovations. And I think actually for me, ECOTOX would be a really good place to start, because including in the cosmetics sector, that's still a gap that needs to be addressed.
Thanks, Julia. Georg?
You want to go first?
I don't mind.
Okay. Well, my clear answer to that is I don't know what is the priority, because I would like to see that further clarified in the process which lies ahead of us, that we revisit the different endpoints, the different information requirements which we have. And I hope that this then clarifies what is really needed to move forward. And I certainly do not have the complete picture on everything on the different endpoints at the moment.
Thank you. Katrin?
I realize that Georg's and my answers are complementary, at least not contradictory. That is a good start. What I wanted to say is there are, of course, two different ways of answering the first question, right? What NAMs are a priority? Yeah. If I think about what is the priority now for making regulatory changes to the column 1 as well as column 2 provisions, such that any change is still workable in practice, there I would have the clear recommendation that we focus on the acute endpoints, where I believe the current regulatory standard requirements are a bit dated and should be amended to the scientific progress so that we have all shared. So that would be the priority for the revision. But if you read the question in the sense of what should be the priority for development, for funding, for more dialogue and research, then I would put my money on the repeated dose protection, because that is the area where we learn the most about the toxic properties of a substance, and where we have the shared feeling that we are not yet sufficiently equipped with NAM approaches to solve these answers. So that's where I would hope more development could be happening soon. Thanks.
And would you recommend people apply for the EPAA Design-a-thon challenge on that one?
Absolutely, of course.
Thanks, Katrin. Doris, next question from Slido.
So the next question is, hazard-based regulation does not favor NAMs. We need to move to risk-based regulation. For regulatory acceptance, the law needs to change. Can you comment on this?
Who would like this one? It's going to be a long 6 minutes.
I'm just taking the microphone to give time to Katrin and Georg to think
what
they're going to say. Let's be clear about it. Again, and then this comes over and over again, risk-based regulation, hazard-based regulation. I think we need to be, again, looking ourselves around the world and see how much we have achieved in Europe and what the other jurisdictions are achieving and how much they are achieving based on what we have achieved in Europe and all the data that we have collected, because we are based on hazard assessments. So, and I will not go into the discussion that was already yesterday about exposure, uses, the information we have on that, and again, workability and where the burden will then rely. So I think if we really look into how much we are able to progress with the safety and protection of human health and environment in Europe compared with other jurisdictions, I think I wouldn't even go in this direction. Personally, not ECHA. And I hope that Georg and Katrin had time to.
Thanks, Diego. Katrin?
Maybe I can offer a thought with the disclaimer that this is my personal opinion. I think there are obviously opportunities or some things that can be considered and can be gained on the basis of risk-based regulation. But I'm not sure that it is useful to have this discussion in a black and white modus of saying first the law needs to change to allow this discussion. I'm not sure that that is a fair statement. In any case, also for risk-based decisions, we need to have an understanding of the hazard. So NAMs need to be able to address that part of the equation. And I'm not convinced about the first statement, if I'm really honest, that a hazard-based regulation does not favor NAMs. If we look at it differently, maybe NAMs could be used more broadly. They could be used in other ways. But I must say I disagree that NAMs could not work in a hazard-based system. Thanks.
Thanks, Katrin. Georg?
Yeah, well, I agree to what Katrin was just saying. I would not sign a statement that hazard-based regulation does not favor NAMs, or that NAMs cannot be used for informing about hazard. Of course, it can. Well, without going into a discussion on what we have or what we would like to have, or what is maybe preferable, hazard-based regulation or risk-based regulation for reducing animal testings. Of course, there is some benefit also to look on other possibilities. EFSA have also mentioned in my presentation, looking on exposure, emissions, uses, and whether we can take some of the information for reducing the need for animal testing.
Thank you. Does anyone else want? Julia?
Yeah, I agree actually a lot with what Katrin was saying, that I don't think it's necessarily a case of needing to pick one or the other. And I think if we were to try and do that, we'd be stuck where we are. And instead, I would say perhaps we need to be looking more at what we can do with Annex 11 in order to accept different types of data for a weight of evidence approach. Maybe we need to be looking more at the kind of data that might be accepted in the US, for example, where it is a different framework. But as well, here in the EU, we've often heard, and it comes up in Board of Appeal cases as well, that the kind of data EFSA might accept, they have different regulatory purposes, different regulatory needs, yet we're moving to a system of one substance, one assessment. And I think actually if we're looking in that kind of direction, it's not necessarily a case of hazard or risk, it's a case of, well, what data is fit for purpose?
Thank you. Any other final comments? So with that, oh, sorry, Thomas.
No, I just wanted quickly to comment on this risk versus hazard. Guys, the fact that we see some successful cases for systemic toxicity based on the risk system does not mean that this is the only way to go. In any system, sooner or later, you need to characterize your hazard. And there is no way out. It's just whether it's in which step of the process. So there is no other way. Guys, we need to find out the way how to identify and characterize hazard, whether we would like it or not. And everybody needs to do it sooner or later. Canadians and Americans and you and us. So let's not discuss hazard versus risk. Let's try to find out how we can characterize the hazard properly, because we need it anyway. Thank you.
Thanks. Okay, sorry, Costanza, we're going to have to.
No, it's just an announcement. It's not a question, because I'm part of the Risk Hunter project, which is part of the ASPIS cluster.
Yeah.
And if you want to be engaged again in 2 weeks by now, there is we have as Riscanta the General Assembly with the open session for stakeholders. So if you want to go on working on this and participate, just contact me. And by the way, we are building a system to, let's say, have an automatic assessment. So it's a combination between modeling and experimental with in vivo in vitro extrapolation. So it's a very interesting tool if you want. And there is also the ASPIS Open Symposium after Eurotalks. So after this meeting, there are other opportunities. So please take it. That's it.
Thank you, Costanza. So I would like to thank my panel very much. Thank you very much to the audience for listening to this last session. I just want to draw attention to the comment that's making its way up the Q&A, that we need to put this talk into action. And I think we all share that feeling. So with that, I would like to close this panel session and hand it over to my colleague Ofelia, who's going to give us some closing remarks. Thank you, everyone.
So we are coming to the end of our workshop, and I could see engagement from everyone in the room and also online, and this is very rewarding for us. Just as a brief reminder, this workshop, it's our support to the ongoing debate, and it's also a way to support the Commission in moving forward with the Citizens Initiative, but also with the ongoing discussions on the replacement of animal testing. And we thought that by bringing all stakeholders, all interested parties together, we could develop a better understanding of what are the needs and how we could make faster progress. So we see strong commitment, and I think this was also what we have seen from the polls, strong commitment and also positive outlook that we can move towards animal-free chemical safety assessment. We all believe that this is possible, but of course there are different expectations in terms of how ready we are and how fast we can move in that direction. We also heard that, and I think all agree that it's important to have goals and timelines to enable making progress. And there is, I think it was also mentioned in the last panel, there has been progress. There is progress, and we seem to move on. And then this workshop, it's yet another opportunity to aggregate the knowledge and find ways to move on. But of course, challenges remain. And building confidence in NAMs it's something required, and one way to do it is through the case studies. Let's consider what would be those case studies, how we could all contribute to those in the research communities, also interactions between industry, regulators. EPAA platform, it's a good umbrella for such initiatives, a place that can glue all the ongoing projects and then make sure that we move on in a consistent manner. Investment is important, and this is what we also heard, targeted investment to ensure the regulatory acceptance. There are many NAMs developed, how we could invest in those that would bring us faster to the regulatory acceptance. And the topic of validation came several times. There is a need for validation. This is seen also in terms of the investments required there. That also facilitates the acceptance of the methods. I think it was just a few minutes ago that we heard about the regulatory context again. And I think Thomas also made the point. The regulatory context is very important when we discuss NAMs. And we have to keep this in mind when considering how ready the NAMs are for acceptance. What is the regulatory context that we discuss? And the hazard assessment remains an issue. And then in the context of hazard assessment, of course, it's also the mutual acceptance of data, the need to have this data accepted at the global level. And also we don't have a recipe that fits all purposes. In different regulatory contexts, we can apply different norms, and then they could be considered acceptable or maybe less. Last but not least, it's very important for everyone, for industry, for the regulators, but also for the scientific community, the legal and scientific certainty of the methods. What do we propose in terms of acceptability to ensure that we have all confidence, and when I talk about confidence, it's not only for us, but it's also for the citizens, that what we put out there for the consumption by everyone, it's safe and it's reliable. So the aspects of legal certainty, scientific certainty, and also workability, because also this issue that was brought recently about the risk versus hazard, we also need to think to have in mind who decides on that. There needs to be a decision taken by someone that, yeah, this is okay, and so this also needs to be kept in mind. And I think the most important thing reiterated along the workshop is the need for dialogue between all stakeholders, and also involvement of all stakeholders to enable progress, but also to understand each other, to understand the different perspectives, where we come from, and acknowledge also that we are all committed in this direction. We want to make progress. We want to move forward with further acceptance of NAMs, of new approach methodologies, and how we could do it in a more in a faster and more consistent way. So overall, and also from the feedback that I've got from you, I think from the ones that I was talking over the past 2 days, I think the workshop achieved the main goal, and yeah, this is a very nice picture showing the lively discussions. And I think there are more that will be probably on the website. So I would like to thank to all of you, the participants in the room, and also the big participation online. So we have about 500 participants overall, and I think this is quite impressive. Thank you for participation, for engaging into the discussions, for the very lively breaks, and also the lively discussions in the online. Also to thank to all presenters, the ones that took the time to bring their knowledge in the setting of the workshop. And also to say that we plan to have the proceedings for this workshop. So Mark Cronin has been working over the past 2 days to try to summarize the discussions, and then we will have proceeding for the workshop that will be published on the website, and then you will also get to know probably through our news or newsletter from ECHA when this will come. And all materials will become available. We will also put the questions somewhere on the website, and we will also try to summarize the questions and then provide some possible answers to the ones that were not answered, because they are acknowledged. There were many, and probably we can cluster them, and then we can see also how they fit with the answers that were given here in the room. And please give us feedback. I think this is important for organizing such future events. In terms of the follow-up, I think there are a number of events coming up, and Constanza mentioned something. There is also some plan at the EPA level to follow up with some more concrete, maybe smaller topics where we could make progress, also considering the input from this workshop. And all presentations are available on the event website, so you can already have a look at them now. Last but not least, there is a big team behind this workshop that I would like to acknowledge and to express the sincere thanks for the work done. The Slido moderators, Bas, Hula, Andrea, and Doris, great work over the past 2 days to keep track of the discussions online. Our colleagues from the AV and communications team, Marco and Adam, for the superb job of getting all online working. We also got very good feedback about the professionalism of the online workshop. And also the colleagues from the communication working in the room, Dobro, Miko, and Marta, Mangavers from the communications that also put messages online or on LinkedIn to make sure that we stay connected. The event team and facility team, Taru, Lina, Ari, and Tuvo, for the support that they gave in the organization of the workshop. Mark Cronin, of course, for the work to make the proceedings. Also to the organizing committee of this workshop, they helped us quite a lot over the past months to ensure that we take into account the different perspectives when setting up the workshop. Catherine Schutte, Katia Lacasse, Julia Baines, and then Gavin Maxwell, thanks a lot. And last, I think the most important people for organizing this workshop, Elisa, thanks a lot for really making sure that everything gets glued and then having everything in place. I know that this has been a challenge. Tomasz for really helping Elisa from the content side of the program, and of course Tiago and Munir for also helping in the organization. And thank you all for the participation, and the ones in the room. I wish you a safe trip back, and hope to see you with other opportunities discussing this interesting topic of transition. Thank you.